Escudero, Honorable Paz Radasa, Honorable Ana Marie Villarasa Suarez, Honorable Resurrection Apcop, Honorable Maria Cordes Arroyo, Honorable Joy Tambunin, Honorable Ruth Mariano Hernandez, Honorable Diego Nonoy T, Honorable Irene J. Saulog, Honorable Christine Alexi Chutor, Honorable Fe Abunda. I hope I did not forget anyone. Please, Comsec, can you check? Comsec, can you please acknowledge also the speaker presence, and also Honorable Arlene Brosas is here. Comsec, will you now acknowledge the speakers, please?
Madam Chair or honorable members of this committee, for today's meeting, we have with us from the committee on from the Council of for the Welfare of Children, we have Undersecretary Mary Mitzi Kahayan Uy, together with Ms. G. Mojica, Ms. Condi Salcedo, Ms. Alpha Larga, Ms. Isa Cabrera, and Mr. Ramil Villafranca. From the Department of Health, we have Dr. Ferchito Avellino of the Epidemiology Bureau, Dr. Anthony Calibo, Dr. Maridith Afwang, and Mr. Justin Dale Soriano. From the Department of Social Welfare and Development, we have Director Clifford Cyril Y. Riveral, Ms. Rizalyn Santa Ines, Ms. Miramel Laksa, Director Wilma Naviamos, and the other support staff of the DSWD. From the Child Rights Network, we have Ms. Micaela Alfonso, Ms. Nitz Dalde. From Break the Silence, also a part of the Child Rights Network, Break the Silence National Network, we have Mr. Jose Nomor Makalalad. We have from Salin Lahi, Yuli Bonganay. From Child Alert Mindanao, Bernie Mondragon. From Unang Hakbang Foundation, Oli Lucas. From Child Fund, Vevet Lascano. From the Action for the Care and Development of Poor in the Philippines, we have Didit Van der Linden. From the World Vision Development Foundation, Queenie Malabanan. From Chameleon Foundation, we have Japet Grace Moleta. From Education Network, Charito Pinalas. From Plan International, Camille Claire Madis. From Save the Children, Attorney Emma Salmani and Ms. Wilma Banaga. From the United Nations, Attorney Anjanette Sagisag and Ms. Rodelisa Barrientos Casado. And from the Center for the Prevention and Treatment of Sexual Abuse, we have Ms. Jennifer Cueva. That's all, Madam Chair, honorable members.
Thank you, Comsec. Again, I'd also like to acknowledge the presence or the honorable members who are joining us also today. It's Honorable, of course, I mentioned na Arlene Brosas, no, but also Honorable Neila Aguinaldo is also here with us. Again, good afternoon to all our members and our guests. This is our first virtual meeting of the Committee on the Welfare of Children, and I'd like to express my deepest appreciation to all of you for taking time to be part of this special meeting. In the last 3 months, our government has doubled our efforts to address the rise of the coronavirus disease 2019. In the rise of an invisible threat, the lives and the health of millions are at stake, including the millions of children who live in communities at risk of exposure to this infection. On April 28, 16-day-old infant Kobe Manjares, likely the youngest COVID-19 survivor in the Philippines, was discharged from the National Children's Hospital in Manila. The baby was born healthy at home on April 12, but rushed to the hospital 5 days later when he began to show troubling symptoms. But not all are as fortunate as baby Kobe. The youngest fatality was a 29-day-old infant from Batangas who was brought to the hospital because he had trouble breathing or shortness of breath. It was then that he was diagnosed with pneumonia. After a few days, the baby died because of late onset sepsis due to severe respiratory infection. The Department of Health has reported that as of today, there are 591 children that are confirmed to have been infected with COVID-19. 35 of them have recovered from the disease, while sadly 10 children are among the number of fatalities. This trend seems to confirm the clinical studies that indicate that children who contract COVID-19 appear to have less severe symptoms and lower mortality rates than other age groups in the population. In fact, DOH data show that majority of pediatric COVID cases are either asymptomatic or only had mild symptoms. This, however, does not mean that they are any less vulnerable than other age groups. The everyday challenges that families and individuals face in this time of COVID-19, the risk to one's health and safety, the closure of schools and businesses, the continued isolation of families in community quarantine, and the loss of employment and income resulting in increased socio-economic vulnerabilities have both immediate and far-reaching effects on children. Children are not immune from the uncertainty and challenges brought about by this pandemic. Millions of children remain uncertain whether schools will open as scheduled or in ways familiar to them. Putting food on the table has become a growing problem, with many of their parents, mostly daily wage earners, have lost their jobs or sources of income. For weeks now, these children have been confined to their homes, thousands of whom live in cramped, informal settlements, further aggravated by the heightened restrictions of their personal movement. This situation could leave millions of Filipino children even more vulnerable to exploitation, to abuse, to hunger, to anxiety, poverty, trauma, and violence, even inside their homes. It cannot be denied that the children are among those at the gravest risk in this pandemic. Therefore, being part of the Social Amelioration Subcommittee under the Defeat COVID-19 Committee, we have already raised several concerns affecting children during this COVID-19 crisis, particularly on 7 key points. First, the economic well-being of children from families not covered by the Social Amelioration Program. Second, the unhampered access of children to healthcare. Third, the rights of children found in violation of the ECQ measures. Fourth is ensuring food security and nutrition. Fifth is the continuity of children's education and learning. Sixth is online safety, especially against online sexual exploitation. And lastly, the protection of children's rights, especially given the restrictions imposed during ECQ. This afternoon, we will listen to our honorable members as well as to our strong partners in the children welfare sector as we seek to understand the current situation of children in this public health emergency, and together exchange insights on best practices and strengthen already workable solutions to the effects of the COVID-19 health emergency on children. By assuring the continuity of learning, economic and social amelioration, by widening access to quality healthcare, by ensuring the social protection of children who may be unfortunately orphaned by this crisis, by expanding public awareness about COVID-19, and by furthering the continued care for children with special needs and those in specific adverse situations. As we share both our concern as well as our ideas in building and assessing strategies in response to COVID-19 crisis, it is our utmost responsibility to ensure that our decisions and that of government most especially are inclusive of the welfare of children and their families, especially the most vulnerable and marginalized. The ability of our children to weather the effects of this public health emergency depends on all of us. Now, more than ever, no one No single child should be left behind. Thank you very much. Now, Comsec, there are... Comsec, can you hear me?
Yes, ma'am. There are some of our members who have registered via Viber their attendance.
That's Kong via Viber is Kong Paz Radasa, no? And also Kong Fe Abunda is also...
Congresswoman Pasa and Woman Maria Fe.
Yeah,
Yes, ma'am.
yes. I think I acknowledged them a little earlier. No? Also, there are two items on the agenda this afternoon's meeting. First is determine the extent and the effectiveness and efficiency of the implementation of Republic Act number 10821, an act mandating the provision of emergency relief and protection for children before, during, and after disasters and other emergency situations, otherwise known as the Children's Emergency Relief and Protection Act. I must say that I'm very glad that this law is already in effect, because with the situation now and with this public emergency, I think I'm very happy that we have this law already. In this regard, the committee would also like to know from the different implementing agency if the pertinent provisions of this law are indeed being followed, and if the needs and protection of children are actually being met and realized during this COVID-19 crisis. Thereafter, based on these reports, we would like to find out if our stakeholders would like to propose on how we can do better the implementation of this law, and even suggest amendments to the Children's Emergency Relief and Protection Act, taking into consideration the peculiar challenges posed by a health pandemic. Second, the committee would also like to listen and understand more intently, with the help of our resource persons, the situation of Filipino children and the challenges they face at this time. For this reason, we have asked the Council for the Welfare of Children to provide a briefing to this committee. This will be followed by reports and suggestions of the Department of Social Welfare and Development, DSWD, the Child Rights Center of the Commission on Human Rights, and the Department of Health. After our government partners, we will also listen to the reports and suggestions of our private sector, the Child Rights Network, Plan International, Save the Children, and UNICEF. Also, if any of our members would need clarification from the reporting agency, please feel free to ask questions after each report. Please, Comsec, may we ask the Council for the Welfare of Children to begin the briefing, please?
May I proceed?
May we ask USEC Mary Mitzi Kahayon Uy to give us a briefing?
Thank you so much, Chairman Yeda Romualdez, for this opportunity that we could give a situational report amid this COVID crisis, what the child protection issues during this crisis. And thank you for the committee to hear us this morning and this afternoon. Isang makabatang araw sa ating lahat. I am Mitch Kahayon Uy from the Council for the Welfare of Children, the focal interagency coordinating body on children, mandated to formulate, review, and evaluate all laws, policies, issuances, and programs on children. Today, I am going to present to you a situational report, child protection issues, particularly focused on the good practices and challenges in the child protection during this pandemic. This is a result of collaborative efforts of monitoring and coordination of the National Child Protection Working Group, or the NCPWG, an interagency committee chaired by CWC with the inputs from the 17 regional child protection working groups. And the CPWG meets every other week to discuss such and to identify child protection priorities. Next slide, please. We have this 8 line agencies members, which are composed of DSWD, DepEd, DOH, DOLE, DOJ, DILG, DA, Department of Agriculture, and NEDA. And of course, we have the National Nutrition Council as members of our board. And we will now give to you the good practices and challenges that we have made during this pandemic. The good practices we have on the policy, we have already made an issuance, the joint memorandum circular with the ILG, or we have this issuance of the ILG CWC JMC number 2020-001, which we have reiterated the protocols on reaching out to children, including those in street situations, in need of special protection, children at risk, and the children in conflict with the law during the enhanced community quarantine. We also had these issuances of guidelines on curfew, continuing routine immunization, among other services during the ECQ. And we have also do reporting or monitoring of violations on laws or policies through social media platforms. For example, the violation on the code milk or the milk code that we have received because of the province have violated the distribution of milk during this quarantine. Development of a city health referral pathway for COVID-19 cases by the CWC National Child Protection Group. So these are the policies, the good practices that we have made. Next slide, please. We also have challenges while we do these good practices, the challenges that we have met. We have weak dissemination and mainstreaming of the national policies to the subnational levels, such as LGUs, regional field offices, because of the lockdown. There's also poor adherence to the provisions and intent of the ILG CWC JMC. Yes, we have found the poor adherence on this, and there's a lack of minimum standard content for curfew advisories. So this was also a challenge for us. Issuance of barangay home quarantine passes to children. Yes, and violation to the milk code by issuing calls for donations of formula, which ran counter to the advocacy on breastfeeding. So if there's one thing that we found na had been not that prioritized, it's the milk code, I guess, because of the yes,
Pandemic.
Opo. And then and because of the lockdowns also. And the absence of guidelines to NGO practitioners to provide assistance to beneficiaries also not qualified as frontliner or essential workers. So these are the challenges we have faced in the issuance of the policy. Now we will go to the data management. We also have these good practices in data management. We have regular profiling and updating of cases and the statistics we have shared. We also have inclusion of RCTWD accomplishments.
Madam Chair.
Yes.
Yes, Kong Joy.
Madam Chair, are we allowed to ask questions after her report or
Yes, ma'am. Yes, ma'am.
after her report? Okay, thank you. Thank you, Madam Chair.
Yes, and then I will be posting the copy of USEC Kahayon's brief in our Viber group. So you have a copy.
Thank you.
Thank you. Please, USEC Mitch, please go ahead.
We have inclusion under data management. We have inclusion under RCPWG accomplishments in the DROMIC reports in some regions, and we conducted a survey to determine the status of the sectoral groups of children spearheaded by CWC committees and subcommittees, like children living with HIV and children with disabilities. So these are the good practices that we have made, but we also have challenges while we are having these good practices. The challenges, there's non-availability of sex and age disaggregated data on children in DOH COVID reporting. Poor handling of confidential health information, which leads to fear of disclosing personal and sensitive information. There's also lack in confidentiality protocols for the prevention of discrimination against children, patients. There's also non-inclusion of child-specific initiatives in the consolidation of reports being published for COVID-19. So this is our, and when regards to data management, these are our challenges. But in advocacy po, we also have good practices that the CWC have done and the NCPWG. Good practices, there's availability of risk communication via social media platforms, which are an effective and strategic way to inform the public. We have also conducted webinars on children's protection and adolescent health as spearheaded and or participated by CWC with other partners. There's also uploading of co-branded CWC social media cards for target clientele, such as children in street situation and children living with HIV, etc. There's also availability of co-branded advocacy materials for children, such as radio infomercials, text blasts through NTC, etc. So we also have challenges in this advocacy. There's the non-availability yet of child-friendly materials on mainstream broadcast and print media because of the non-open of yung mga publishing natin, yung mga radio, mga newspapers din po natin. And of course, we have on health and nutrition, we have good practices din po that CWC and NCPWC have done. We have this establishment of hotlines for adolescents and child health and community kitchens. We also have presence of standard protocols for handling patients in hospitals, including children. Efficient referrals to DSWD and the DOH for adolescent health concerns, including children living with HIV, and issuance of guidelines on nutrition action during COVID-19 and on healthful and nutritious family food packs and sustainable food sources. We also face challenges on the health and nutrition. One of those is ensuring that there is availability and access to maintenance, medical treatment, including primary care for children in the continuum of their treatment during the COVID-19. There are some yung nag-maintenance po, medyo nahihirapan po on this. Difficulty in access to services due to restricted mobility and transportation, difficulty for children living with HIV to access their treatment hubs due to fear of disclosure in quarantine checkpoints. There's also challenges on distribution of relief packs which do not meet the standard nutritional requirements. So, yung pong mga pinamimigay, yung pong standard nutritional requirements natin haven't met. So, in coordination po, we have good practices that CWC have done. The continuity of interagency coordination meetings of CWC structures through online platforms to support COVID-related operations. We have done upcoming is the Council Board meeting, CWC Technical Management Group, Committee on Children and on HIV/AIDS, Subcommittee on the Protection and Welfare of Children in Street Situations. We have done a meeting with the Subcommittee on Children with Disabilities, the NCPWG Working Group. We have done meeting with them, and the LCPC Consortium. So on these are the good practices that we have done with our partners. Next slide, please. On the protection, our good practices, we have active coordination of the National Child Protection Working Group and the Regional Child Protection Working Groups through the provision of the technical assistance, reporting of initiatives, mapping of child protection issues, and monitoring of child protection protocols being implemented at a local level. Availability of helplines for reporting of child protection issues. We have this Bantay Bata 163 hotline. As we partnered and made MOA with them, it is still, we still accept calls. Kahit po sarado ang ABS-CBN for now, we still receive calls and ongoing pa rin po ang Bantay Bata 163 hotline. So, we also have easy reporting through social media platforms na minsan ina-address po direkta sa amin. So, what are the challenges in protection that we are facing now? Next slide, please, Ayan. Difficulty in accessing VAUSI deaths and BCPC and other services for possible cases of abuse in some areas because of the non-functionality of the BCPC and accessing the VAUSI deaths. We are having these difficulties for children. Challenges in strengthening child protection measures to track violence against children, online sexual exploitation on children, and online recruitment of children by armed groups. So, ito pa rin po ang isang sa mga challenges. Mishandling of children who violated curfew and poor implementation of the DSWD or the CPIE law. And then the non-availability of ready resources and services for street families, including indigenous people. So the temporary shelter is one of our challenges on the protection of children. On the child participation, we have done partnership with the Positive Youth Development Network to engage adolescents online. We have issuances of guidelines by CWC and NYC for safe adolescent and youth engagement in online platforms while in community quarantine. And in education, we have also issuance of DepEd guidelines for the remainder of school year 2019 to 2020 and the advisory on the start of classes for 2020 to 2021. Launching of DepEd Commons, an online platform for public school teachers where they can access online educational resources to support distance learning modalities. The availability of monitoring mechanisms, COVID task force, and DRR focals, adherence to privacy protocols for learners diagnosed with COVID-19, and adherence to RA 10-821 regarding the use of schools as COVID-19 isolation facilities, despite schools being supposedly the last option for evacuation. And then the challenges for this, the strengthening of ICT facilities in all DepEd schools, particularly to areas with no stable online access. Weak policies to address possible discrimination and isolation for children who are infected with COVID-19 or for children whose family members contracted COVID-19. Those are the good practices and challenges on different aspects, but our recommendation with all the good practices, CWC wishes to forward the following recommendations. Number one is to sustain coordination between the NCTWG and the RCTWGs to address child protection issues. Number two, to recommend the primacy of JJWA and CPIE law over RCC 151 and RA 11332 in the implementation of curfew when children are involved. Number three recommendation is to ensure social media materials, advisories, and guidelines reach the barangay and its intended users. And number four, recommendation, monitor the implementation of existing laws, policies, and guidelines for children. Number five, to develop and disseminate monitoring reports for guidance by concerned agencies, government agencies. And number six, ensure that the concerns of children are included and considered in the formulation and implementation of future programs, interventions of the government in response to the new normal, including the Balik Probinsya program, now an EO 114. Thank you so much, and let us create a child caring and child sensitive society for, by, and with the children. Thank you so much in behalf of the CWC and CPWG. Thank you.
Thank you, Yusek Kahayon. Before we move forward, no, I'd just like to acknowledge the presence of Congressman Malu Acosta Alba, DS Baby Arenas, and also Congressman Raymond Mendoza. I believe that some of our members have questions for Yusek Kahayon. Maybe we should start with Congresswoman Joy Tambunting. Kong Joy.
Chairman, thank you for acknowledging me. And I'd like to ask a question to Yusek Mitch Kaayon. Yusek Mitch, I'm a very simple person, and my district is not very big, but you know, from the time that COVID started, we've been trying to reach out to the children. That's my advocacy kasi. We've been reaching out to the children. We've been giving them as much as possible milk. It's the milk that's very important. Yusek Mitch, I just want to ask one question. How can you help my district when it comes to milk for the children?
Yes. There's one that has been reported, Madam Chair, and thank you, Congresswoman Tambunting, for that question. We have also addressed this question to DOH and NNC. Kasi nga po, dahil nga po doon sa natanggap naming report, if I may say, one province is Rizal, na hininga ng explanation kung paano nga, bakit nagkaroon ng pagkakataon na siya ay nakapagbigay ng donasyon sa gatas. This is also one of our queries sa DOH, and they have responded to us na yung, sana po encourage pa rin yung milk code po natin, na kung sakaling ang nangyari po kasi noon, ang pinagbibigyan na lang po ng gatas ay yung talagang nagpo-formula na. Pero hanggat maaari po sana kasi in-encourage natin na mag-breastfeed pa din. However, kung talagang halimbawa ay ang magulang ang siyang merong sitwasyon na meron siyang infected po siya, yun po yung pagkakataon na pwede po natin tanggapin yung donation. So naintindihan po natin yan, ma'am, sa local, na talagang available nga po, yun po yung na medyo nakakalungkot, available po ang lahat ng formulas. Maraming pong gustong mag-donate. However po, because doon sa ating milk code, na hindi po sila meron po kasing parang nagtitigil para sa kanilang tanggapin ito. So balit meron po tayong ini-request po sa atin ng DOH na i-observe pa rin po natin ang pag-abide sa ating milk code. Na yun po yung sinagot nila. Hanggat maaari, we encourage na sumunod pa din doon sa ating proseso doon sa ating batas ng milk code. Kasi nga po, yun po yung tinanong din namin, natanong din po sa amin, paano kung infected yung isang magulang na nagbibigay ng breastfeed, yan, ganyan. Yun po yung tinanong namin. At sinabi naman po nila, we encourage pa din na sumunod sa milk code. Yun po yung, tapos kung paano po kayo magkakaroon, ma'am, yun nga po yung,
Madam.
Opo. Ma'am, I guess DOH po, si Doc Anthony is with us. Siya rin po kasi yung nakapag-share din po sa atin with the permission of Madam Chair.
May we maybe ask from someone, our speaker, our representative from DOH to answer from Joy Tambutiri about.
Yes, Madam Chairman, thank you very much. It's really frustrating. We have so many children and they cannot have milk. The mothers are really crying out for milk. I'm not talking about the breastfeeding mothers. I'm talking about children 10 and below. Really
Availability.
breastfeeding yon.
Oo, yung availability of the milk, no? Comsec,
Yes.
and do you have any representative from DOH?
And po, si Anthony.
Good afternoon po to all the members of the Committee on the Welfare of Children. Good afternoon, Madam Chair, and of course to our distinguished representatives and members of the committee, also our resource person. As a response,
Before you respond, though, in connection lang with Congresswoman Joy's question, I'd also like the challenges experienced with the availability of breastfeeding, especially for lactating mothers during this pandemic. Do you have any suggestions regarding the proper implementation of the, for example, dapat merong exemption for milk donations? Can you answer that, please?
okay. I'll be responding, Chair, for the queries, your query, and at the same time from our from Representative Tambunting. Of course, as response to the clarification needed by the CWC Executive Director Yusek Mitch Kahayan Uy. First po, we maintain that LGU procurement is allowed for milk formula, and procurements are not equated to milk donation. And that is why if there are infants less than 6 months old who are being formula fed, these infants may be given milk formula procured by the local government unit. What is important is this set of children or infants 0 to 6 months is known to the barangay officials, to the barangay health emergency response team, and of course to the local city health officer or nutrition officer who will be the recipients of these LGU procurements. Now, we understand the financial capacity of poor families who have infants less than 6 months old, who have never been breastfed, and are dependent on milk formula. And that is why the Milk Code does not prohibit procurement of milk formula products for these infants who are dependent on milk formula. So that is the clarification. The Milk Code does not prohibit LGU procurement of milk formula products for these age groups. What is being prohibited is the donation of the products, especially from milk companies and of course from other organizations that are within the scope of EO 51. This pertains to Section 51 of the revised IRR of the Administrative Order 2006-0012. It does not distinguish who the source of the donation is, but it pertains to the product prohibited from being donated. So donations are prohibited, but procurement is allowed. What is the difference po? When we haphazardly receive donations, these donated products will become universally distributed to all infants and children and may affect those infants who are being exclusively breastfed, and the behavior of these breastfeeding mothers may be affected. So we are preventing those scenarios that the universal distribution of these milk products may be even harmful rather than helpful. If there are products that are to be donated and outside of the scope of the code, which means products above 3 years old, because there are children who are also in need of milk formula, as our good representative has mentioned, that there are still some children who are dependent on this, then the local government unit, as again, may procure, and those who will be donating products outside of the scope of the code, Section 52 may write to DOH for approval. It is important that there is notification to the Department of Health because the DOH will provide guidance in the acceptance of these donations outside the scope of EO 51. So we have, the DOH has also approved many circumstances that NGOs, civil society, and even milk companies who have donated products outside EO 51, outside the scope of the EO 51, and we allow this. So for example, there were full cream milk, there were some food products and even cash being donated by these companies. And DOH has has approved these donations with conditionalities. No, so it is important that those who will be donating the products will also follow protocol. Now, in the event that certain local government units have already received these donations, no, we urge these local government units to be very to be very cautious in the distribution. Why? Because the administration of these milk products may not be hygienically prepared. And oftentimes, after being distributed, these products may be used inappropriately. And therefore, health concerns of these children may also come up after consumption of these milk products. No? So that's the reason why the DOH has been very cautious and has been always reminding people on the risk of milk formula feeding and likewise the universal distribution of these milk products. So what we are suggesting is that when an infant is already 6 months and above, we encourage feeding of these infants. What we call this complementary feeding, and that the priority is more food to be given, no, to be prepared by the families for the LGU to also support food security by giving food rations, warm meals or hot meals. And the frequency of the feeding of the infant 6 months and above should be more promoted. No? The food is actually more filling than the formula milk. No? If the child is fed 3 times a day, we are assured that the child will not be hungry. No? And this is more sustainable after the ECQ or the GCQ will be lifted. The dependence of milk formula products will not be there. No? So we are afraid that if we start a family on milk formula and after the GCQ or ECQ, sustainability of this intervention will be also faced by the local government units. No? And that scenario will be more financially demanding from local government resources. And that is why if they are still breastfeeding, they can continue. And if they're already on the age when they are already feeding, then we promote them to feed their children more rather than to offer milk formula products. I hope, Madam Chair, that this clarification by DOH is sufficient for our members and also to other attendees of this meeting. Thank you, Madam Chair.
Thank you, Dr. Anthony. Kong Joy, do you have any follow-up questions?
Madam Chair, I'm sorry, but obviously I beg to disagree. I really disagree with our speaker right now. In the areas that I move around in, especially in the depressed areas, there is no such thing as a hot meal right now or 3 times a day meal. So the mothers are really looking forward to hopefully getting milk, and there's no milk. So it's really frustrating. I don't know what to do right now. I'm trying to get donors for milk. If I do get a donor for milk, I will have to go through red tape now, pala. I will have to ask permission from the DOH before I distribute it. So that's the only thing that I'm gathering right now. There is no 3 meals a day right now, even with the social amelioration. No such thing. So thank you, Madam Chair. I don't think my questions had been answered. They have been answered in a negative way. Maraming salamat po, Madam Chair.
Madam Chair.
Madam Chair.
Yes, Yusek Mitch Kahayon.
Madam Chair, we appreciate the observation of the Honorable Tambunting on this matter. We would like to somehow request Congress if you have seen this law or the milk code na may mga ano on this topic, because I could see also on this immediate kasi nangyari po sa atin is very unique itong pandemic na to. First time lahat po na nararanasan natin, nakita natin first time lahat. Maybe with the suggestion of the Honorable Tambunting, you can do something about our codes, our laws, na para pagka magre-respond dito sa mga ganitong emergency situation. So, we appreciate Honorable Tambunting on her observation, Madam Chair.
Madam Chair, may I ask a question?
Yes, Congresswoman Escudero, please proceed.
Yeah, thank you, Madam Chair. USEC Mitch, I'd just like to find out, gaano kadami ang employees nyo in your CWC? To be able to monitor, the whole country, the children's in the whole country.
Yes, what we have done on the report that we have given to you, Madam Chair, Madam Escudero, we have received reports from our regional networks or regional staff. So we have collated those information from regional RSCWCs and NCPG as we meet them, as we convene them online, Madam Chair.
Okay, kasi I noticed that your report says a lot of things that you have to take care of for the children. Yung monitoring nyo, I think, for the welfare of children, I think is not enough. I'm sorry, but kasi, like for example, in the internet, I could find things like children are asking for donations, like the SOS Philippines villages. They're asking for donations because they don't have anything to feed for their children. And hindi ito nabibigyan ng tuon. I don't know if you are aware that you have to get in touch also with some organizations that foster homes, etc., where there are children who are there who needs help.
Yes,
Madam Chair.
Yes, Madam Chair, Madam Congresswoman, we acknowledge for our shortcomings when it comes to gathering of data. Still, we are admitting that we are staff right now, but that's the reason why we coordinate this, receiving reports from other partners. That's the reason why we got also data from UNICEF, from other networks. For now, we have 32 staff and 17 COS po. So yeah, right now talagang kulang po kami when it comes to gathering of data. That's the reason why we also encourage the functionality of the LCPCs and DCPCs to give to us the reports. Kasi sila na lang po yung tool na nakikita namin for now na pwede makapagbigay sa amin ng mga reports and information, Madam Chair.
Madam Chair, probably we can do something about it in probably giving them more PS to be able to monitor, right, the welfare of the children. Kasi as of now, meron tayong COVID, no? So you don't see children in the streets, etc. But before the COVID, before the ECQ, you would find children in the streets. And I don't know how you are monitoring these children who are outside of their homes, etc., etc. I don't know if this is under DSWD. We could probably ask DSWD if they're monitoring this also. But I think it is also your responsibility as the CWC with the Welfare of the Children's Council to look into their welfare. So, kumbaga, if you see children outside of their homes, what do you do about it? Ngayon, siguro wala, no? But afterwards, what do we do, Madam Chair?
Yes, Madam Chair, Madam Congresswoman, we really acknowledge your opinion, your suggestion of adding us, making us a bigger manpower, have giving us. That's the reason why we are also requesting Congress to make us a commission. Kasi po, ito din po yung makapag-ano. That's why may pending po kami. Even last Congress pala, I'm sorry, we are requesting na po. Sa dami po, diri niyo po, 38 million po ang bata ngayon. Ilan lang po kami nag-a-address sa
Okay.
mga Thank you so much, Madam
Yeah.
Congresswoman, for that observation. Thank you po. We appreciate it.
So, Madam Chair, I think probably we could probably look into that law about the CWC, their mandate, etc. Thank you, Madam Chair.
Thank you so much po. Thank you.
Yusek Kahayon, we recognize the challenges that CWC is facing during this pandemic. We have a very large scope to cover, and we really need to address really the problem of the welfare of children. So if you can give us a proposal on how we can help the CWDC strengthen, diba, in addressing such challenges during this pandemic. And then also going back, maybe we can ask CWC to submit proposed amendments po dun sa milk code given the challenges during the COVID-19 crisis.
Madam Chair.
Is there any other questions maybe focused more on the CWC? I think if there are questions for Dr. Anthony of the DOH, we can reserve that later after his presentation.
Thank you so much po, Madam Chair. And we are happy na nakikita po itong mga to na kayo po na nandyan sa legislatura ang tinitingnan po namin makakatulong sa CWC. 38 million po ang Pilipino, mas marami pa po kami kaya sa senior citizen. Kaya sana po pagtawanan natin ang pansin ng mga bata. Maraming salamat po.
Maraming salamat, Yusek Kahayon. To our members, do you have any questions for Yusek Kahayon for CWC? May Kong Arlene or
Excuse me, I think Congresswoman.
Madam Chair, my question is on the DSWD particularly. Will there be a presentation of the DSWD?
Yes, ma'am. There will be a presentation. DSWD will present next, and you can ask your question.
Yes, thank you, Madam Chair. I will reserve my questions to the DSWD.
We ask Kong Arroyo if she has a question to CWC.
Yes, I do. Madam Chair,
Please
I
proceed,
read,
Kong Arroyo.
yes, I'm sorry, can you hear me?
Yes, ma'am.
Okay, I read that USEC has gotten in touch with the subcommittees on children with disabilities. May I please ask if there is any particular program for children with disabilities? Thank you.
Yusek Kahayon, please.
Oh yes, we just gathered the data on disability kung nabibigyan po ba sila ng karampatang pansin kapag po sila po ay kagaya po ng we just give attention to this children po, and yes, wala pa po kaming program on this during the pandemic, but we're trying to gather data muna po as of this time. And yung surveying, yun pa lang po yung nagawa namin sa ngayon on how we could help them during this pandemic po. We're ongoing pa rin po yung aming survey, ma'am.
Oo, pero hindi ba, Yusek, there is an urgency especially for those dapat ma-implement yung mga programs to ensure the psychological well-being of children?
Oh yes, opo. Yan po, ongoing po namin yan ngayon. We do seminars on some parents with the disability agency po na we have to brief or debrief ang mga children, yung psychological intervention po natin sa kanila, explain what is this situation happen, this pandemic happening right now. So, yan po yung ginagawa natin. Continuous po ang ating, ngayon, may mga webinars po tayo And ito po, yes, we are willing to share na daw po ang survey these results. We are willing to give. Yun na lang po yung i-share muna po namin. But the ongoing po yung aming mga psychological interventions po, webinars, through webinars po, Madam Chair, Congresswoman Arroyo. Wala pa po kaming program for now. But the members po, meron na po sila.
May I please, Madam Chair, may I please ask the user that when you have programs, please contact me because I am chair of the persons with disabilities, and I would really like to give them some good news for their children. Because you know, there's so many. We're in the Philippines. We're loaded with children. So I would be very interested in knowing if and when you have programs, so we can really help them. Please. Thank you very much.
Thank you.
Madam Chair, Congresswoman Arroyo, we will be glad to give you right away po those people na kailangan makapag-coordinate po sa inyo and giving you the data on all of this during the pandemic po. Thank you so much, Madam Chair.
Maraming salamat, Yusek Kahayon. May we ask Congresswoman Abunda if she has any questions for the CWC? Kung Abunda is... if not, then we'll proceed with the DSWD, the presentation of DSWD.
If I may be allowed,
Yes.
ma'am, if I may be allowed, Congresswoman Abunda posted her Viber, her question.
I hear, it's here. Okay.
Yeah.
For you, Sec Kahayon, the question from Congresswoman Abunda is, may I ask how can children have access to hospitals and clinics during the pandemic for their scheduled checkups and even emergency cases?
Access to hospitals, ma'am?
Yes, access to hospitals and clinics during a pandemic for their scheduled checkups and even emergency cases.
Yes. They do not receive, no? Opo. They do not receive. Unfortunately, ma'am, we have already receiving reports that hospitals do not receive children and do not encourage muna po any consultations right now. Kasi nga po, pero tele na lang daw po. Yun po yung nakarating na report sa amin. So, hindi po ini-encourage sa mga bata ngayon na pumunta muna sa mga hospitals for their check-ups and yun na po yung isa po sa challenges na hinaharap po namin. They are being discouraged by hospitals po.
Emergency.
Opo.
Baka,
telephone na lang daw po muna.
baka Dr. Avellino can expound on this later after his presentation.
Kasi for emergency. Pag emergency.
May we proceed already to DSWD, the presentation of DSWD? ComSec? Thank you, Yusek Kahayon. Thank you very much.
For the Department of Social Welfare and Development, we would like to ask Director Clifford Cyril Rivelar to give the presentation.
They may discourage going to the hospital for consultation. Okay. Consultation. How about for emergency cases? Nag-emergency yung bata.
Hello, Congresswoman Fe Abunda. Is this Congress?
Yes. Good afternoon, Chair, Madam Chair. Yung tanong ko narinig ko yung answer sa akin. Okay, yung consultation, how about for emergency? Kung emergency yung bata, emergency dadalhin, okay ba yun? Dalhin sa hospital?
Yes, ma'am. maybe DOH can, ma'am, do you want to reserve that question later for DOH after the DOH presentation?
Yes, Madam Chairman. Yes, Madam Chairman.
Thank you. Thank you, Congresswoman Abunda. Thank you very much. May we ask the DSWD to proceed, please?
Madam Chair, good afternoon, and thank you for allowing the SWD to come to be able to make a presentation. To the members of the Congress, attendees from other organizations, other attendees, good afternoon. I am Director Clifford Riveral of the Disaster Response Management Bureau of DSWD, and I will be presenting to you the DSWD update.
Please proceed, sir.
Presentation, ma'am.
Okay. Comsec, yung presentation ng DSWD, please. Can we share it with the members and our guests?
Miramel, are you going to share it or? Hello?
Hello.
Hi, ma'am. I think it was forwarded
Yeah.
po by our DLLO to you, ma'am.
Yeah. Yes, but I was under impression it was just a backup. Anyway, I will find
Okay.
it, ma'am. Can we just get it for a while? Can we proceed in the meantime with the DOH, ma'am, before we
Yeah, sige.
go?
Yeah, so that-
I'll just get it.
Yes,
Thank you, ma'am.
since we are preparing for the we are waiting for the presentation of the DSWD, maybe we can proceed with DOH first, because I know there are a lot of questions that our members would like to ask the Department of Health. May we ask the representative of DOH for his report, please? Si Dr. Avelino, Doc.
Good afternoon, Madam Chair, and to the members of the Congress and all the attendees. Can we have a slide share?
Yes. Comsec,
Yes, ma'am.
there. I can see it na.
Okay.
Yeah.
So what
Yeah.
we will be presenting, Madam Chair, for this afternoon is the profile of confirmed COVID-19 cases amongst children. So this would be 0 to 18 years old. Can I have the next? So this slide shows to us the number of total cases as of May 12, totaling to 11,350, of which 191 or 5% comprises children or young men and women aged 0 to 18 years. This slide shows to us the distribution of ages of cases and as to sex. And it also shows to us the number of deaths per age group. As we could note on the right side of the slide, that the age range is, the median age is 11, and 55% of cases are female. The 15 to less than 19 years of age are the most affected age group. The next slide is the distribution of cases as to the different regions. So if you would notice, regions 7 or Central Visayas, the National Capital Region, and the Calabarzon or Region 4A registered the highest number of cases, even if you're going to look at the third row, which is the active case. Now, in this slide also, you would be able to see the number of cases who passed away from the disease. And if you would notice that per case fatality ratio, the region 4A register high, followed by NCR and Region 3. This slide shows or gives us the status of children as to recovered, those who are still in active infection, and those who passed away. So we have a 6% recovery rate. Now, for those who are still sick, we would be noticing that majority of them, or 93% of them, are mild. And surprisingly, and also we need to be careful of this figure on the asymptomatic, which is 7%, because these are the silent spreader. I would like to inform the body at this point that I used to be positive for COVID-19 as well, and I was asymptomatic. Now, what is staggering in this number is the number of deaths that had been recorded amongst this age group, which gives a 2% figure. We will be showing you details on the profile of those children who passed away. Now, this is the case fatality rate of those that were recorded in the earlier slide. And the next slide will tell us the children less than 1 year of age and the distribution of cases. You would notice that the less than 1 year old, we have 2 passed away. I'm sorry, 1 month old is 2 passed away. And then, yes, and then 1 is still for verification. Now, this is the distribution of the 27 cases of children less than 1 month old, of children less than 1 month old. So if you would notice, a big number of cases is coming from NCR, again followed by Calabarzon and Central Luzon. These are all the number of cases in the of children less than 1 month old. Now, this slide gives the profile of children who passed, who died, totaling to 10. 60% of them are males. Ages range from 1 to 18 years of age. The age group most affected are the 15 to less than 19. Also, we are looking at also the 0 to less than 1 year old. Now, 4 out of the 10 recorded deaths had history of comorbidity. So we have here the comorbidities that were reported to us: cerebral palsy, AGE, gastroenteritis, asthma, and tuberculosis complications. Now, in summary, as what we have been had been presented in the previous slide, so most of the cases are seen in Central Visayas, National Capital Region, and the Calabarzon. The next slide will now present the profile of cases of children in these 3 regions. This is the epidemic curve for Central Visayas. And if you would notice that in May 4, there had been a sudden increase of cases seen amongst children, and this is a result of mass diagnostic practices that they had in Central Visayas. And this is the distribution of cases as to localities. So a big number is seen in Cebu, followed by Lapu-Lapu City. Now, for the National Capital Region, if you would notice that the trend of children had been somehow stable through the past 3 months. And these are the cities where you have the reported cases of children less than 18 years old. So we have a total active case of 206 with 6 deaths. This is the epidemic curve for the Calabar zone. Children comprises 4% of the total number of cases reported in this region. And this slide shows the distribution of cases reported in this region. There was 1 death reported. And this is a continuation of the distribution of cases. We will be sharing these updated slides to the members of the Congress. Now, the profile of confirmed cases, this is in summary. So for the Philippines, as of May 12, we have a total of 591 of 5% children amongst confirmed COVID-19 cases. The top 3 regions are Central Visayas, NCR, and Calabar Zone. Ages range from 1 to 18, with more females getting or contracting the infection, with an age group most affected is the 15 to less than 18 years of age, and a death a case fatality ratio of 2%. Thank you, Madam Chair. Ay, wala sound. Wala tayong sound.
May we ask COMSEC to post the copy of DOH presentation in the Viber group, please? COMSEC?
Yes, ma'am. We will do it now, ma'am.
I'd like to ask the members if they have any questions. I know Congresswoman Abunda has a question. Paano po yung mga batang may mga emergency?
Ano po yun, Madam?
Ang question po ni Congresswoman Abunda is, may I ask, how can children have access to hospitals and clinics during the pandemic for their scheduled checkups and even emergency cases?
Okay. I think it would be more appropriate if Dr. Calibo can answer the question. But for cases that are considered or who are suspect for COVID-19, they are immediately brought to the TTMF, the temporary treatment and monitoring facilities, wherein they are being monitored on a daily basis. Now, if in the process they develop a severe condition or they have been turned out that the laboratory test turned out to be positive and they need hospitalization, then the local government unit, health authority, or the Department of Health can conduct the patient to a referral hospital.
Because in my understanding, di ba, Doc, they don't accept children in regular hospitals first, di ba? Because high risk yung mga bata. So, for the scheduled checkups, immunizations, and emergency cases, they are just referred to smaller hospitals, or what is the process?
What I gathered po, Madam, is for the regular immunization schedule, children are still being brought to the local health facilities. These are the primary health facilities. Since ang ating mga suspect cases are now facility-based confined, so yung ating mga primary health centers are freed of managing potential respiratory infection cases.
Okay,
maybe Dr. maybe Dr. Anthony Calibo can add on this.
Dr. Anthony, would you like to add?
Thank you, Madam Chair. Thank you, Director Avelino, for your presentation as well. I agree po that there are circumstances affecting the consult of families bringing their children to their respective healthcare provider, and this will require different modes of consultation through telemedicine, if possible, and the other one is if this can also be done through home visits, especially uh, in our barangays, wherein the barangay health emergency response team can actually go to the families with health concerns of children. So we also advise not to expose children unnecessarily to travel and bringing to hospitals if not really in need of emergency interventions. So the Department of Health is preparing for its department memorandum, identifying the list of conditions that should still be continued to make sure that this will be uninterrupted and services will still be provided, especially those with chronic conditions. So, for example, if there are children who are on hemodialysis or peritoneal dialysis, or those that are scheduled for their regular blood transfusion, or even scheduled chemotherapy, these are still allowed because discontinuing these interventions may even result to complications of these children. Likewise, we have also highlighted several emergency conditions that will be really important for the Barangay Health Emergency Response Team to provide assistance to these families. So there's a list that have been enumerated already. We have been working on this department memorandum, Madam Chair, and we have submitted this for proper clearance from our principals and superiors, and hopefully within the week, this department memorandum will be issued as well to be officially adopted by those involved in the implementation of the community quarantine in affected areas of the country. But we maintain that mild conditions may be visited by a barangay health emergency response team. For example, if it's just a few days of fever, cough and colds, or short bouts of diarrhea, they may be managed at home. And of course, proper counseling and education will be done. However, if this compromises the health of the child, for example, they're very dehydrated, they're unable to take in the oral rehydration solution, or the breathing is very fast, and the child is unable to breathe properly, then these conditions of dehydration and possible pneumonia would warrant emergency provision of services, and of course, LGU ambulance conduction as well. But if services can still be continued, then it is through home visitation. So Director Avelino has emphasized that the DOH has reminded families that the routine immunization is still needed to be provided, and even some situations in private hospitals, they're finding options how to protect children by finding alternative areas wherein private doctors can actually hold clinic and keep them away from the busy and possible risk of acquiring the organism in high-risk areas. So there's no excuse not to provide timely immunization to our children. And of course, the roles of our health workers in the community is likewise emphasized to make sure that we are taking care of the health and nutrition of all our children. Thank you, Madam Chair.
Thank you. I'd like to acknowledge the presence of Congressman Mike Defensor. Good afternoon, Kong Mike. Well, I just hope DOH can make sure that despite the ECQ, GCQ conditions, children are not deprived of the healthcare services, diba? Paano po how do you go about the telemedicine?
Hindi.
Telemedicine, Madam Chair, if I may respond to your query, may not be universally used right now, and these are very dependent on technology that is at the disposal of the healthcare provider. So adult and pediatric care practitioners are giving this as an option, but for now, we are not familiar with any public health sector use of telemedicine. I think it depends and it varies to LGU capability if they're also doing this. But many LGUs have created Facebook pages and their constituents are actually being entertained to provide online consultation. But of course, there's always a disclaimer that it cannot fully assess the health status of the child solely through telemedicine. And if really in need of emergency services because of the limitations of telemedicine, then the instruction is really to make sure to bring to the nearest facility for proper evaluation. Thank you, Madam Chair.
Thank you, Dr. Anthony. Any of our members would like to ask a question or pose a question to DOH?
Yes, Madam Chair.
Please, please
Madam
proceed. Yes, please proceed, Congresswoman Brosas.
Yes, Madam Chair. We are really concerned dito po sa news ng mga nakaraan na namamatay yung mga bata dinedenay sa ospital, sa government hospitals in Manila. Particularly, meron pong 2 sick children aged 1 and 4 years old who died shortly after they were turned away by government hospitals in Manila. Now, we would like to ask yung DOH kasi ito naman po malinaw no? Dinenay talaga ng ospital pero malala yung kalagayan. May need for pediatrician or cardiologist pero hindi sila naasikaso. Pag ganito po, this was in April 9 hanggang April 13. Mga pangyayari from April 9 to April 13. So, ano na po yan? Well into ECQ na tayo yan Kasi March pa naman tayo nag-start ng ECQ. So, supposedly, then we are looking forward na atin ay maging maayos. But at the same time, meron talagang pangangailangan para sa facilities ng hospital, particularly sa mga children. So kapag mga ganito po yung nangyayari, parang maliwanag po dito, negligence po ito. So ano pong masasabi ng DOH kaugnay dito? Thank you, Madam Chair.
Thank you, Cong Brosas. Dr. Anthony, please.
Yes. We will have this look into by our DOH Center for Health Development for Metro Manila, headed by its regional director, Corazon Flores, Dr. Corazon Flores, whom we will recommend to have an investigation done on the incidents being shared to us in this forum by our fellow legislator. We maintain that there is no restriction for children to receive emergency care. There is no rule that children will be refused of care. And obviously, the child might be in heart failure if this was a congenital heart disease problem. And the first approach of any primary care facility, especially in the emergency room setting, is to assess the condition of the child, provide basic intervention within their capacity, and if not within their capability, then that facility who was able to see and assess the child should make arrangements to transfer the child to a higher level facility who has the capability of further treating the condition of the child. But turning away children who are in need of emergency services at the doorsteps of the emergency room area without providing any basic first aid or medical care warrants an investigation from the DOH Center for Health Development. Certainly, this will not go unchecked. And of course, we will be coordinating with the legislative staff of our dear representative through our legislative liaison office. And we will make sure that proper sanctions will be done if found to have violated rules and regulations on guidelines on providing emergency care, especially to our children. Thank you, Madam Chair.
Thank you, Dr. Anthony.
Yes.
That's very,
Yes, Madam Chair.
yes, nakakalungkot yan, no, Dr. Anthony, and I hope that that will really warrant an investigation, and I hope that you can give us a report or an update on that investigation and give a copy to our dear Congresswoman Arlene Brosas. Congresswoman Arlene?
Yes, Madam Chair. Oo, chine-check po natin kasi mga public hospitals po ito eh. Walang mapupuntahan yung mga, lalong-lalo na yung mga mahihirap nating mga kababayan na hindi naman kayang pumunta sa mga private hospitals. Kung nangyayari po ito sa mga public hospitals natin, tapos hindi sila maaasikaso at ihahanap pa sila ng mga tertiary hospitals na kulang ngayon at ngayon ay may pandemya, talagang napakahirap po ng sitwasyon. So, please look into this, investigate this well para po sa DOH. Ibigay na lang po namin yung 2 hospitals na meron na sinasabi natin. Thank you very much. Maraming salamat po sa DOH. Maraming salamat, Chair. Thank you.
Thank you, Congresswoman Arlene Brosas. Merong question, Dr. Anthony, si Congresswoman Pastor-Dasa, Madam Chair. Was contact tracing conducted in these cases of infected children? If there was already, what was the result and how did the children get infected? From Congresswoman Pastor-Dasa.
Madam Chair, Director Avelino will be able to provide some details on this. Thank you, Madam Chair.
Good afternoon again. Madam Chair, may ginagawa po tayong contact tracing sa bawat kaso ng COVID. Kung ito man ay bata o matanda, ay tinitignan natin kung sino yung kanyang immediate or close contact. So ang close contact po, ito po yung kasamahan niya sa bahay at or yung mga health providers na nagbigay ng serbisyos sa pasyente habang siya ay nakakonfine sa hospital. So currently what we are doing now ay minamap out namin kung ilan pa ang mga pasyente or COVID positive na kinakailangan na ma-contact trace, and we can provide you with the data on contact tracing after this meeting, Madam Chair.
Thank you, Doc. But paano yun, Doc? How about, do we have any data or report on children whose parents have been infected with COVID? And paano yung protocols nun? Are the children taken away? Who will take care of the children? Tapos paano if they are orphan, di ba? Because of this of this pandemic or because of reasons of death. How do we take care of the children who are orphan?
Sa ating pong proseso ngayon na pinapatupad po, kapag ang isang pasyente ay, kunwari yung parents ay turned out to be COVID positive, the children are brought to the TTMF where they will be monitored and cared for during the time that they are being also observed whether or not they will develop the signs and symptoms of the disease.
I think Congresswoman Arroyo has a question. Cong Arroyo. Congresswoman Arroyo.
I'm done.
Okay.
Well, I want to ask Joy.
Yes, ma'am.
I wanted to ask, let us say if it's a child do they have anything special that they can do for this child? Or does this child, I mean, he cannot hear, he cannot speak, the mother might be deaf also. They have a hard time getting there. How can they be helped by the public hospital? Madam Chair.
Dr. Anthony.
Madam Chair, the question was a bit choppy. If I may have it, can we repeat the question, Madam Chair?
Congresswoman Arroyo,
Yes.
kindly repeat your question, please.
Doctor, let us, Department of Health, please. Let us assume my child has a disability. I
Yes.
also have a disability. I bring the child to the hospital. Is there any way someone in the hospital, I'm deaf, the child is deaf, how can I reach out to them and how can they reach out to me? Most of them will go to public hospitals, as you know, sir. For these poor children, these poor parents. Thank you.
Doc Anthony, I think Congressman Arroyo's question is if if for example lang she has a disability and then her child has a disability, how are they able, parang paano sila makakakuha ng tamang healthcare based on, 'di ba, sa mga challenges that they face?
Yes, yes. Okay. As mentioned, the provision of the health and nutrition services for all children, including children with disability, should be maintained, especially at the local government level through our barangay health and nutrition workers. So in the nutrition interim guidelines that has been drafted by the UH, we also incorporated children with disabilities to receive the same health and nutrition interventions that will be provided as well by barangay health workers, barangay nutrition scholars in the community. And should any of these children with disabilities require emergency assistance, then the barangay health emergency response team should make arrangements to bring the child to the nearest facility who will be able to provide assistance and proper medical evaluation. As part of those children who will also require continuation of their therapy, for example, physical, occupational, and speech therapy, relevant to their developmental conditions, we have incorporated this as well in the department memorandum that they should be exempted from any travel restrictions, because it has been a very long time that many families whose children require developmental interventions have not probably visited their physical therapists or occupational therapists. And we are afraid that this may be detrimental to the improvement of the developmental conditions of these children. So we have incorporated this as well to maintain the uninterrupted interventions for children with disability. So the rule is the barangay officials should automatically respond to these children, especially with disabilities. Services have to be continued, especially for health and nutrition, including immunization. And should they require assistance to be brought to the health facility, for emergency consult because of a life-threatening condition, then they have to be given assistance as well by the Barangay Health Emergency Response Team. Thank you, Madam Chair.
Thank you, Doc Anthony. In connection with that, Congresswoman Malu Acosta Alba has a question. The sense of security, safety, and normalcy of children are being challenged like never before during this pandemic. How is their mental health and psychosocial well-being being addressed?
Mental health concerns, Madam Chair, are really one of the areas that are very challenging, especially in the home settings. And we know that even adult members of the family would have mental health challenges as well. So it's really a family-centered approach to mental health interventions. And the DOH has really provided social media cards on maintaining mental health for children and adults, but I think it's really more of the adults. What we encourage for families is to provide a combination of play and learning interventions as well, because this divert the anxiety of children who may not understand fully what's going on, why they're not allowed to go out, why is it that they've been staying so long in their houses, etc. And we also advise that whatever learning interventions that they have started the child prior to the quarantine restrictions have to be continued as well. So the book reading, playing of toys, and interaction by mothers, parents, and their children are simple and effective mental health interventions already. Of course, when families would be stressed out because sometimes behavior of children may be very difficult to manage, there are parenting interventions that are also in place, and I think our colleagues from the DSWD would be in the best position to share the parenting interventions as well that have been in place even prior to the quarantine restrictions, Madam Chair. So we hope that parents will really have peace of mind, and they will not be anxious or stressed as well. And of course, their children would also understand in simple ways that they can explain to them why is it that the new normal is different
Hello.
already. Thank you, Madam Chair.
Thank you. Thank you, Dr. Anthony.
Madam Chair,
If our members, I know our
Madam
members have a
Chair?
lot of questions for the DOH, but
Madam
I'd
Chair?
like to proceed to DSWD.
Madam Chair? Madam Chair, may I just add to what Dr. Calibo has mentioned? This is Dr. Afang also from DOH, if I may.
Ma'am?
Hello.
Yeah,
If our
I can hear
members
you.
If our members have questions, we will refer it to DOH. No, but I think we should proceed already to DSWD. The slides of DSWD is ready na, no? So also, Comsec Jing, if you can post a copy of DSWD's presentation in our Viber group, please.
Yes, ma'am. We will po.
May we ask DSWD to please proceed?
So again, to the members of the Congress, attendees of this conference, other attendees, good afternoon. I am Director Clifford Riveral of the Disaster Response Management Bureau, DSWD, and I will be presenting to you the DSWD Update Agency Report on the Situation and Welfare of Children during the COVID-19 and its implementation, included in our presentation are gaps and challenges, and the agency's recommendation to address these. As a reminder of Section 4 of RA 10821, which states that we are primary guiding document in protecting children, pregnant, and lactating women during disasters and support their immediate recovery. The next slide will be an update for the children. These reports are from our regional offices, and most of it, if not all, started during the enhanced community quarantine or the ECQ implementation, which had been addressed by joint efforts by the PNP and the field offices of the SWD. For the first case, this is a case of children of 7 from Quezon City that were left unattended after their parents were arrested by local enforcement officers due to violation of laws. The second case is children from Barangay Holy Spirit, Quezon City, who are left to fend for themselves after their mother cannot travel back from Bulacan due to the lockdown. On the third case, it's a case of a teenager and her siblings in Bikutan as being threatened by her own father a drug addict and cannot seek refuge from her relatives due to the lockdown. For the fourth case, is a child-headed household was not provided by the social amelioration program as the guidelines was specifically for families headed by adults.
Director, we'll just ComSec, the slides of the DSWD is not moving. So can you kindly check, please? Yung slides ng ating
I think it's, ma'am, they are the ones po nag-share.
Ganun ba?
Yes, ma'am.
Yes, ma'am. They wanted to share it from their end. Although we have one ready from Pastor.
So, Direct, I just wanted to let you know baka kasi we're getting confused kasi parang hindi siya nagmo-move yung slides mo.
Yes,
or okay. O sige, please proceed.
On the next slide is the children trafficking. This slide shows it by age.
Hindi, we only can see yung implementation of RA 10821. Director Riveral. Hindi siya hindi siya gumagalaw eh. Yung we can only see the first page if
Yes, ma'am.
okay lang yan. O, sige. Okay, please proceed na rin. Ayan.
Trafficking.
Here, this is Romel. Pwede po.
There.
Mr. Rommel, would you is it okay na po, DSWD? Because if not, we can ask our host, Mr. Rommel, to.
Ayan.
I think it's working. It's working.
Director Clifford, no, we're talking about the trafficking in person cases, no? By
Ma'am, is it-
age. Yes, we can see it na, but we are talking na in trafficking in person, di ba?
Yes, ma'am. We can go to the previous slide.
Okay, yes. Sige.
And so these are the reports that we have received from our regional offices. On this slide, ma'am, is the trafficking in person by ages, by age group. On the next slide, ma'am, this is by type. Back, please back.
Ayan, next slide.
So this is the trafficking in person children. Next slide. On situation of women and children, these are the reported cases of domestic violence. This is as of May 4, ma'am.
Can you?
From the start of the ECQ.
Can you
We
move
have
that slide?
388 and 351, respectively. On the next slide is the provision of our basic. Next slide, please.
We know from the DSWD who is presently sharing.
I think the DSWD is having technical difficulties, no?
Yeah, maybe we can ask our host, Mr. Rommel. Can you? Yes, ma'am.
While they're fixing the slides, no, I know our members have copy already of the
Yes,
DS
ma'am.
presentation. Baka they can look in our Viber committee na lang para we can move on and move forward and proceed, no? So, meron to our members, we have a copy of the DSWD slide in the committee Viber. So, kindly open your copies na lang in the Viber group. Si Director Riveral, can you please proceed?
Yes, ma'am. So on the provisions of for the provisions of basic services for women and children, these are the things that we have done. Provisions of healthier and age-appropriate family food packs, This is also the close monitoring of milk code violations and milk donations, provisions of age-appropriate hygiene kits and sanitation kits. On our interventions, we have established psychosocial support hotlines. This is, of course, aside from our hotline through social media and email addresses to assist all affected and other beneficiaries. We are also in close coordination with law enforcement agencies, issuance of child protection advisory, and dissemination of the CWC and DILG Joint Memorandum Circular 2020-01 creating the case management protocols for children in need of special protection. For our fifth intervention is the issuance of immediate foster care placement for children needing emergency placement, issuance of guidance to DSW manage RCFs reiterating DSWD's child protection policy, the procurement of modified enhanced family food packs for Luzon, Visayas, and Mindanao. For our eighth, dissemination of memorandum to all regional offices to support to Milk Code EO51 or the National Code for marketing of breast milk substitute, breast milk supplement, and other related products to promote, protect, and support exclusive breastfeeding for infants from 0 to 6 months old. And lastly, to ongoing distribution of age-appropriate hygiene kits and sanitary kits to all affected families. We also have noted the gaps and challenges which I have mentioned earlier. The applicability of RA 10821 to other programs, specifically emergency foster care policy guidelines, is not clearly defined, especially in the case of ECQ. There is a complexity in implementing the CEPC given the nature of the ECQ as a pandemic, such as case management, psychosocial support, etc. These are issues concerning street children and issues concerning homeless families. For the third gap is the capacities of the TANODs and barangay workers in reporting referral of unaccompanied and missing children. For our recommendation on the RA 10821 is the activation of child protection desk in barangay, city, municipal, LGUs to provide assistance during lockdown or ECQ, such as facilitate family tracing and reunification, psychosocial support to children and families, and reporting of child abuse cases. We also recommend stronger penalties for the different level of LGUs with no localized CEPC system and mechanism. We also recommend the prioritization of rescued children for health screening, testing prior to admission to residential care facilities for children, quarantine facilities for unaccommodated, unaccompanied, and separated children whose parents are with positive results to such epidemic or pandemic. The inclusion to RA 10821, the provision stated in RA 10165 and the DSWD Memorandum Circular number 3, which is of 2014, which is the guidelines to foster care for services. And lastly, the child protection should be mainstreamed in other clusters such as law and order cluster, where DSWD is also an active member. That ends my presentation. May God bless us all. I'm ready for questions, ma'am.
Thank you, sir. I know Congressman T has a question for DSWD. Kong T.
Yes, Madam Chair, can you hear me?
Yes, we can hear you loud and clear. Kong T.
Madam Chair, I received so many complaints in my district coming from the solo parents and the lactating mothers. This is with regards to the implementation of the special amelioration program of the DSWD, Madam Chair. Particularly, Madam Chair, because most of them are live together with their parents as of now. So, but the DSWD, Madam Chair, consider them as one family only. If the parent, Madam Chair, is a member of SSS, is a pensioner of SSS, so the whole family excluded from the amelioration fund. If the parent is a 4-piece member, if the parent received the amelioration fund, the lactating new family and the solo mother are excluded, Madam Chair. So my question with the DSWD, Madam Chair, can they explain what is their point of, in their own point of view, what is the meaning of family or household? Pag ang solo parent ba nakikitira sa mga magulang nila, considered ba as one family or two families na? And then number 2, Madam Chair, what can we do about them, Madam Chair? Kasi hindi sila nakatanggap ng amelioration fund, unfair daw para sa kanila. And then baka po pwede sa second tranche, baka ma-prioritize sila, Madam Chair. Thank you. Salamat po, Madam Chair.
Thank you, Kong T. May we ask DSWD to answer, please?
Sir, actually, what we are doing here is we are assisting the LGU in doing this survey and assessment. And then we are the ones to facilitate in the distribution of the family food packs and the social amelioration program, in implementing this social amelioration program. Now, if there are cases where there are things that were not, or there are families that were misincluded or were not included in the assessment, we are accepting also complaints, and we act on them. So the members of the DSWD normally addresses this, and we personally go to their houses or places, and we reassess the situation before giving up or giving the necessary support for this family. Thank you, sir.
Yes, Madam Chair, can the DSWD prioritize for this solo parent and the lactating mothers who did not receive the amelioration fund because of the definition of DSWD with regards to family? Kasi po, ang sabi nila, pag nakikitira ka sa parent mo, kahit may sarili kang pamilya, kung kasabay kayong kumain, isa lang ang pagluto nyo, so isang pamilya daw ang bilang yan. So can you give priority to these lactating mothers and solo parents who did not receive the special amelioration fund in the second tranche? Kasi ang sabi ng DSWD, meron pa daw for the month of May, baka pwedeng may pasama yung mga itong mga solo parents and lactating mothers. Thank you.
Madam Chair, may I?
Yes, Director Riveral. Because nga, I hope that DSWD would be very clear and concise on their definition of solo parents at lactating mothers, di ba? Kasi kawawa naman yung mga hindi nakatanggap dahil nga I understand where Kong T is trying to he's trying to explain na kawawa yung mga nanay na nasa isang bahay, and that really is the reality. Minsan isang household lang, madaming pamilya. So I hope DSWD can address his concern.
Yes, ma'am. We will be very more than glad to receive all the names of those who are solo parents or who are not given this grant, and we will assess them accordingly and give them the priority for what is left with our resources.
Kompi.
Yes, salamat po, Madam Chair. That's all.
Yes.
Uh,
May
This is Congresswoman Ruth of Laguna, Madam Chair.
Congresswoman Ruth Hernandez, good afternoon.
Good
Do you have a
afternoon.
question for DSWD, ma'am?
Yes, Madam Chair. A while ago po, nabanggit ni Congressman Diego T. yung social amelioration program. So I would like to ask something with regards to SAP also. Binanggit po ni Congressman D, yun po mga solo parent and lactating mothers. And another one po na gusto ko yun po sana na mabigyan ng pansin ng ating DSWD are those families na meron po mga malnourished children, because I was told po, I am talking with our barangay nutrition scholars, talaga naman pong alam nila yung mga pamilya na meron pong mga malnourished children. So I think po, bigyan din po ng diin or emphasis na ito rin po ang mabigyan ng tulong ng ating pong DSWD sa pagbibigay po ng SAP. I know that they have second wave po ng pagbibigay or yung SAP distribution. Like in our case in Laguna, kasama po kami sa top 3. So alam ko po na ang lalawigan po namin will be given another round of SAP. Ano po, dahil kasama pa po kami sa modified enhanced community quarantine. So yun lang po yung hihilingan ko po sa DSWD, Madam Chair, na sana po pag-aralan din yung mga may datos po ang mga barangay nutrition scholars, baka they can look into it po and bigyan ng emphasis at bigyan ng mas pansin po those families na meron po mga malnourished children, Madam Chair. Thank you very much.
Thank you, Congresswoman Ruth Hernandez. Also, DSWD, in connection to what Congresswoman Ruth Hernandez said, no, was the number of children per household considered ba in identifying and prioritizing SAP beneficiaries? Kasi iba ang household of 4 sa household of 8. May pamilya na 2 lang ang anak. May pamilya naman na 8 or 6 yung anak, 'di ba? But they still get the same amount. Hindi ba dapat ay per child din yan to ensure yung protection and the welfare na tama yung nakakakain ng tama yung mga bata? So, yun ang gusto ko sanang malaman din, katulad din sa sinabi rin ng mga ni Cong Ruth Hernandez, di ba? How do we protect malnourished children? And how do we make sure that tama yung distribution ng relief packs? Director Riveral?
Hello, ma'am.
Hello. Yes, sir.
Yes, ma'am. Ma'am, with regards to the amount or the volume of how much we give, we try to average it to 5 per house. So if they go below 5 or beyond 5, so kasi mahirap, it will be too hard for us to try to look into all the families. So we tried to level it off down into 5. Now the social amelioration program is more of in support for the food. This is for the food. So we computed this 8,000 or 5,000 depending on the cost of living in the various regions of the country. We computed this that the amount will be exact for 1 month. Now, with regards to your question on malnourished children, we will try to reconsider this, and it is already included in one of our administrative orders. This is administrative order number 3, and we will try to review and come up how to address these malnourished children. Ma'am, may I ask, are these malnourished children consolidated in one house, or are they in an orphanage, or are they in different houses? So,
may I answer that?
Yes, Congresswoman Hernandez.
Yes. Actually, this was reported to me by our barangay nutrition scholars. So they are in the different households of the community, sir. So meron pong listahan po na mga malnourished children ng ating barangay nutrition scholars. So kaya po hinihiling ko doon sa mga report ng BNS, since may parameters sila to know po kung sino yung mga malnourished children in the area, in the community. So I think po may datos po sila na pwede pong i-report sa ating po mga kawani ng DSWD, sir. because that's the work of BNS. They go around the different households at talagang wini-weigh po nila yan. Talaga pong wini-weigh nila base po sa bigat o timbang ng bata. Diyan po nila na-assess yung mga malnourished children natin, sir. So they have the data, ang ating mga barangay nutrition scholars, and I think po we can get the data from them, kaya po pwedeng maging basehan siya para po sa pagbibigay ng tulong natin sa mga pamilyang nangangailangan. And I think po the fact na merong malnourished children sa pamilyang to, so there are the ones who are in need of the social amelioration program of the government, sir.
Question. Ma'am, may I answer, ma'am?
Hello, Madam Chair. May I respond po dun sa malnourished children?
Can you please, I'm sorry, I cannot see you, but can you please identify yourself? Hello?
Yes, ma'am. This is Miramel Laksa po from the Program Management Bureau of DSWD.
Yes, please
We
go ahead.
are the ones monitoring po the implementation of our supplementary feeding program. And yun nga po, with regard to the malnourished children po, our field offices po are now currently on the process of fast-tracking our implementation of the supplementary feeding program, because as you all know po, our previous guidelines on supplementary feeding program is not does not coincide with what we have now in terms of the health crisis or health emergency. Kasi nga po, ang daming limitations because of the ECQ. And therefore, kinailangan po nating i-amend yung ating guidelines para po less people ang kakailanganin and less movement din po ng mga tao. Kaya nga po, we identified some strategies on how we could proceed with the implementation of the supplementary feeding program. We will give you po a copy of our guidelines, and we were just informed po this morning by our field offices that given that most of our LGUs ay ang priority po nila ngayon is the payout for the SAP, ay susunod naman daw po yung ating supplementary feeding program na haharapin nila. And this is of course in coordination with our BNS, with our BHW, and of course our child development workers and the rest of our LGU personnel. So yun po, tinignan na po natin yan with the help of the National Nutrition Council, the DOST, FNRI, as well as with the Department of Health on how we could best and effectively implement supplementary feeding program given the COVID-19 pandemic.
Thank you very much. Congressman Hernandez.
Thank you very much, Madam Chair. Thank you very much.
Thank you. Do we have any other questions for DSWD?
May I,
Yes,
ma'am?
Madam Chair.
Yes.
Ma'am, I would like to ask what is the location of what particularly is this barangay you're mentioning, ma'am? May I ask Congressman Ruth Hernandez, ma'am?
Okay. Can I answer, Madam Chair?
Please proceed, Congresswoman Ruth Hernandez.
Actually, Director, I'm talking in general sa buong district ko po. So I'm citing the municipalities of Bae, Los Baños, and the city of Cabuyao. So ako naman po kasi I'm working in coordination with our barangay nutrition scholars to know the problems in sa ground po at sa community. And I'm very particular with the needs of the children dahil po isa sa advocacy ko yan. At ang mga reports po na dumadating sa akin ay ang mga problemang kinakarap ng ating mga kabataan, lalo higit yung mga malnourished children natin, Director. That's why I'm very happy with the report po kanina, sa DSWD na ito pala po ay binibigyan na ng focus, and after SAP ay ito na po yung isusunod nilang programa na bababa po sa different localities po sa ating community. So thank you very much, Director. Madam Chair, thank you very much.
Thank you, Congresswoman Hernandez. Thank you. Any of our members meron pa ba tayong tanong sa kay DSWD Director Liberal?
Yes, Madam Chair. Madam Chair, I have a question.
Brosas, please proceed.
Yes, Madam Chair. I have a series of questions for the DSWD. Specific po, very specific. So Section 4 of RA 10821 states that DSWD shall formulate a comprehensive emergency program for children. So nire-refer po dito, dapat may programa, no, na nabuo ang DOH, ang DSWD, no, sa DSWD po, Director Clifford, kailan po ba kayo nagsimula, no, na buuin yung emergency program for children ninyo, comprehensive emergency program for children, plus ano po ba yung structure nito ngayon, ano yung itsura, para medyo alam naman namin kung ano yung ginagawa, ilan po ba yung social workers na nagtatrabaho nito. Alam naman natin na simula nung March 9, nung dineclare yung public health emergency, supposedly, meron ng kaakibat ito na emergency program. So, March 9, tapos March 15, community quarantine na, March 17, pinatupad na yung ECQ. So, 2 buwan po, doon mula noon, kailan po ipinatupad itong comprehensive emergency program for children ninyo?
Ma'am, as shown on the screen is our manual in coordination with DILG. This was published way back 2017, ma'am.
Yes, Director Clifford, Madam Chair, I am asking about the particularity of the pandemic crisis. Kasi po, dati yan eh. Pero yung aangkop po sa kasalukuyang kalagayan na merong pandemya, hinarap natin itong pandemya, ano yung mga naging aksyon sa ilalim ng programang ito mula nung pinatupad yung ECQ hanggang sa kasalukuyan. Particular for children po itong itong Republic Act 10821. Idugtong ko na rin po kasi kaugnay din naman yan, nakalagay naman sa Section 4 ng Republic Act na concerned agencies and local government units shall immediately establish an option for transitional shelters. Nakadefine po dito refers to structures temporarily constructed by the government intended for families affected by a disaster while awaiting transfer to permanent shelters, prioritizing vulnerable and marginalized groups. Kasama po rito yung orphaned, separated, unaccompanied children, pregnant, and lactating mothers. Ngayon, meron po ang tinayo ng mga transitional shelters na ito habang humaharap tayo sa pandemyang ito. Maayos po ba yung naging pasilidad dito? Tapos, paano po yung mga naging tirahan ng mga batang lansangan at saan sila maaaring dalhin habang may bantaan ng COVID-19? Or ano ang nagawa ng DSWD? Thank you, Madam Chair. Please answer, Director. Thank you.
Yes, ma'am. Thank you, ma'am, for that question, ma'am. Ma'am, as we all know, this pandemic is something new to this situation we are into. We have never experienced this kind since way back 2010 when SARS and MERS were still there. So these provisions that is included in this Republic Act has not included this kind of pandemic or epidemic that has affected mostly children, mothers, everyone. Pati yung how we are currently looking into how to build these evacuation centers when the day will come, when typhoons start hitting us. How will we try to prepare everything in such a way that we still observe this social distancing, how to address this, if there is somebody infected, how can we, these are new things. And we are now trying to revisit our policies and try to understand how can we address this later on, or if this pandemic goes on, we will try to come up with our best solutions, with our best effort, how to address this. I cannot answer this for the moment as we are still trying to address this. As of yesterday, we had talked to other UN agencies and we have already discussed this. And they too are giving a solution, proposing solution, which may or may not be applicable in our situation, in the various situation here in the country. So please allow us time to revisit and understand this policy, for this is something new to all of us.
Madam Chair, Madam Chair, yes, oo. I was hoping, no, na sasagutin po tayo ng guidelines at saka yung direction ng IATF kasi nagawa naman po na maitayo yung interagency, no, task force at saka paano ito, the children can't wait, no? Hindi po pwede na sila ay kasunod ng mga pagpaplano. Kailangan po talaga ito aggressively ay sagutin. Kasi kaya nga po meron tayong RA 10821, ano, na Children's Emergency Relief and Protection Act. This is one of the guides na kailangan natutupad ng gobyerno natin for the fundamental rights of our children. So, in-expect ko sana po ay nai-disclose sa atin paano yung itsura ngayon, kabahagi ba ng pinag-uusapan sa IATF yung children in emergency natin para alam po natin, no? Tsaka bahagi ba ng hindi lang po, sabi kasi kanina, payout muna yung uunahin eh. Tapos saka pa lang yung feeding program, supplementary feeding program. Pero parang, di ba dapat kasabay yun nung payout kasi hindi naman, the children can't wait. Kailangan po natin silang asikasuhin at pakainin. At ang DSWD po ay binigyan ng ganitong trabaho ng RA 10821 natin. At yun po sana yung tanong natin na dapat mailinaw ng DSWD sa atin. Now, I think tama naman, no, na kasi baka devolved, kailangan nila ng pakikipag-usap sa iba pang mga LGUs, kailangan makausap yung para magawa yung mga programs. Pero Madam Chair, itong mga pangangailangan na to, we are well into the second month, no, ng ECQ. At hindi natin makita-kita, o ngayon pa lang natin nakikita, yung situation ng children in this kind of pandemic crisis. So, ibig sabihin, Madam Chair and Director, mukhang meron tayong napag-iiwanan dito. Kailangan po natin itong asikasuhin immediately, no? Yun po. So kung ganun po, baka kailangan po talagang upuan, pag-usapan ito ng mabuti kung paano ipapatupad itong Children's Emergency Relief and Protection Act. So far po, ang mga na-report ninyo ay kaugnay doon sa ginagawang food packs, emergency relief para sa mga situation, ano po, tapos iba pang mga policies on milk code, mga ganyan. Yung next ko pong actually, meron pa po akong next na tanong. Ang next ko po na tanong ay particular na sa mga cases. So, yung cases po, Madam Chair, can I go to my second question na po? Kasi mukhang, oo.
Dr. Calibo would like to answer yung unang tanong mo, Kong Rosat. Would you like him to answer first or will you proceed with your second question na?
Siguro I will proceed to my second question para masagot niya po yung second question ko na particular na doon sa mga ano po ito particular na mga cases, no? So last April 5 po, a barangay captain ng Pandapaki, Pampanga made LGBTQ quarantine violators dance sexily in front of a 15-year-old. May kaso rin po ng mga pinapasok sa loob ng kapaong ng ilang minuto ang mga menor de edad na lumabag sa curfew. Tapos, nadadagdagan po, tumataas ang mga cases natin ng mga online sexual exploitation of children. Marami po ngayon, ano, kasi especially naka-ECQ, no? Yung mga bata ay nasa loob ng bahay nila at yun yung delikado minsan. Noong nakaraang Abril, may natanggap din po ang Gabriela Women's Party na report ng mga cases na agaran, pinapatawan ng case ang mga menor de edad na nahuhuling hindi sumusunod sa curfew. Hindi sila ibinabalik kagad sa magulang. Sila ay kinukuha at dinadala kagad sa mga bahay pag-asa at doon talaga nagkakaroon ng problema. Hindi pa po ako nagtatanong kung kamusta na yung mga bahay pag-asa natin ayon sa inyong monitoring, kung nakakapag-social distancing pa sila, anong itsura sa loob nila, paano sila inaasikaso, paano ina-ensure na hindi sila magkakahawaan sakaling magkaroon ng cases, and meron pang testing sa kanila. Yun yung mga ganun pong mga tanong. Ano? Hindi po lingid sa atin yung kaalaman na yung sitwasyon, dumarami yung mga kabataan na nakakaranas ng violence and exploitation at abuse dahil hindi po madali ngayon na humingi ng saklolo dahil nga naka-quarantine ang mga tao. So, yung tanong ko po, ano po yung mga interventions na ginawa ng DSWD kaugnay dito? Maraming salamat, Madam Chair and Director Clifford.
Salamat, Congresswoman. May we ask Dr. Calibo to answer, please? Sa tanong ni Kong Brosas. Dr. Calibo? Then maybe we can ask Director Clifford to answer na lang instead.
For allowing me, sir. With regards to these abuses by apprehending or law enforcement agencies, we'll have to check it out. We have to check it out with the DILG because we don't have reports regarding this. But we will check it. We will liaise with DILG and try to find out what are these cases and how did it arise. On abuses inside the house, these are some things that, of course, we cannot really find out not until there is somebody from the inside who tell us. These are hard things to. It is also difficult for us to find out, regardless of what agency would do it. I think it's really very hard to find out, just like the case that we presented about the abuses made by a drug addict father. So, nakalabas lang kasi yung sa bahay at nakapagsumbong. So, without this kind of interventions made by people from the inside of the house, we could not do anything about it. But we will try our best to allow, again, I will liaise with the DILG to make their presence be felt in the areas so that if there are any violence being undertaken, it could be addressed accordingly.
Thank you.
Madam Chair, pwede po magdagdag? DSWD Miramel Laksa.
Yeah, please proceed, Miramel Laksa.
Yes, thank you, Madam Chair. In addition po dun sa sagot po ni Director Rivera, we at the Program Bureau po ng DSWD Central Office, considering that we are the ones monitoring the concerns of the different sectors po, yung pong nabanggit po kanina ni representative po ng Gabriela, it was reported din po to us, and immediately po, we coordinated with our concerned regional offices, yung pong LGBT na pinagsayaw, yung mga pinapasok doon sa mga coffin, immediately po, tinawagan namin ang aming concerned regional offices who in turn coordinated with the concerned local social welfare and development office para nga po masagutan yung concern na yon ng ating mga kabataan. And with regard to online sexual exploitation of children, kami din po sa DSWD bilang nasa amin po yung lead secretariat ng Interagency Committee Against Child Pornography, Against Trafficking, and Violence Against Women and Their Children. We are in close coordination naman po with the NBI, particularly with the Office of the Cybercrime. Kapag meron pong napopost sa aming Facebook page ng mga ganitong cases po, ay immediately po talaga ay kino-coordinate na po natin ito sa ating mga kasama, particularly sa NBI, para nga po talagang ma-actionan na po ito kaagad. And after that, yun nga po, reference po sa ating mga local social welfare and development office for immediate case management po. Yun po, Madam Chair.
Thank you, DSWD Miramel Laksa. Oo, I completely agree. No, dapat may immediate intervention kaagad. I think we need to understand the urgency and the effect the children are having, no, during this pandemic. Talagang nakakalula yung ano nangyayari, especially the effects on children. And one case of child abuse is one case too many. So I hope the DSWD sana at maraming salamat sa pagbigay pansin, no, and to just making sure na napoprotektahan natin yung welfare ng ating mga kabataan. Si Dr. Anthony Calibo would like to say something from DOH also. Dr. Anthony, if not, then let's proceed to the next.
Madam Chair?
Yes.
One last, yes, habol lang, Madam Chair. Yung tanong ko po kanina sa mga cases, may reported cases po ba tayo sa mga bahay pag-asa ng COVID sa mga bata?
Hello? DSWD po. Opo. Mirabel Laksa, ma'am.
Yes, please proceed.
Yes, Madam Chair. I-check po natin siya sa ating JJWC. Sila po kasi ang nag-oversee ng mga bahay pag-asa. And then we will provide the committee po immediately the report on our monitoring of the bahay pag-asa po.
Thank you, Madam Chair. Last na lang siguro, Madam Chair, huwag po natin kakalimutan, lalong-lalo ng mga children in urban poor communities. They have limited access to clean water, proper hygiene, and good nutrition. Yun po talaga yung kailangan nating tugunan. Kaya importante po yung pagkakaroon talaga at mag-formulate ng comprehensive emergency program for children talaga nito, no? At paano ito mag-figure in sa kasalukuyang kalagayan ng pandemya o ng krisis na ito. Maraming salamat, Madam Chair. Maraming salamat, Director Clifford. Maraming salamat, Miramel. Thank you sa DSWD.
Thank you din po.
Thank you very much
for allowing us to present and be able to answer some of your questions.
Thank you very much. Let's proceed now to the next presenter. Can we have the Child Rights Center of the Commission of Human Rights? May we have CHR, please?
Hello, ma'am. Good afternoon.
Good afternoon.
Good afternoon, ma'am. I'm Jill Regalado from the Commission on Human Rights. I'm trying to share my screen.
I think we can see.
Are you able to see it po or not yet?
Yes, we can.
Okay, thank you, ma'am. Ma'am, my apologies as I will not be able to open my video since I have a very unstable internet connection, but I will be presenting my slide presentation. So, good afternoon to Madam Chair and to the members of the Congress. I'm from the Child Rights Center of the Commission on Human Rights. And in this 10-minute presentation, we will be providing you with information on the issues and concerns monitored and responded to by the Commission on Human Rights since the start of the lockdown. So, for the first slide, we have clustered the concerns under health, nutrition, and hygiene. We have received incidences, reports of medical facilities in different parts of the Philippines where patients were said to be rejected, or patients who are in need of immediate treatment were rejected, and this led to a number of deaths among pregnant women and children. We have also monitored lack of access to healthcare and medicine, especially of children with disabilities, and these were reported to us by our regional offices. We have also received reports on lack of access, lack of diapers and hygiene kits for children, especially in the provinces, as well as the issue which was earlier discussed on the availability of milk for infants in the regions. We have also received reports on children missing out on vaccines because of fear of being infected by the virus. So here are just some of our sources. But the CHR has already issued a statement on these incidences. We have monitored the cases of Mary Jane Alpide, who died in labor after being turned down earlier by 4 medical facilities, of Catherine Bulatao, who successfully gave birth in her home in Caloocan, but since she required medical procedure, she eventually died losing due to blood loss because he was, well, allegedly refused by 6 hospitals, and by Miss Josefina Barros, who was refused treatment by 9 hospitals after suffering from stomach ache. We have also received reports of sick children who have also died after government hospitals they were brought to hospitals and failed to give medical assistance. Also, a case of a 19-year-old student with autism spectrum disorder, which was suspected to be infected by COVID-19, was said to have died after 3 hospitals refused to accommodate him. According to the reports, these facilities allegedly demanded advance payment before admitting these women and children. Other hospitals have inadequate facilities and capacities to fully attend to the patient's condition, considering that there are other pressing issues. There are pressing issues they're currently handling. While, of course, the CHR recognized that the current overstretched capacity of hospitals to provide critical care, especially this time of national emergency, the death of these patients cannot be justified because of the refusal of these hospitals to accept them. The Commission seeks justice for the victims and calls for stricter implementation of the anti-hospital deposit law. We also reiterate that in the health crisis, the ultimate goal of the government is to save as many lives of our fellow Filipinos. Otherwise, we will defeat the purpose of emergency health measures, which we are currently implementing now in the country. So this is the statement released by our CHR spokesperson on the alleged refusal of medical facilities to provide immediate medical attention to women and children. We have also issued a statement on addressing the maternal and infant health care among the COVID-19 pandemic, just to assess that pregnant mothers and newborn babies are highly susceptible to infectious diseases. So even with the challenges brought about by COVID-19, we ask the government to continue protecting the health of women and children, as this is part of our mandate, and it is also included in the 2013 Sustainable Development Goals. Also, we have monitored violence against children and online sexual abuse and exploitation of children. We have observed heightened occurrence of abuse, especially during times of emergency. And we have also received reports of online sexual abuse and exploitation. And this is brought about by the widening availability of internet among children. And we have also noted that some of these cases were driven by poverty because some of the parents may have, in order for some of the parents to cope with the economic effects of the pandemic. So we have actually received the data from the PNP. If you look at the data, there is a decrease of cases that were reported pre-ECQ and during the ECQ. While we are expecting that cases of domestic violence would increase considerably because of the lockdown, we note that there was a decrease, and this was brought about, of course, by the lack of the underreporting of the victims. The low turnout of cases is expected, especially now that there are many barriers facing the victims and the mobility constraints. So very few would be able to report their cases, but later on you would see in our monitoring that there has been a lot of cases, especially on women suffering from domestic abuse, which we have monitored through our online reporting portal. Again, we have issued a statement on this issue. And then on the issue of online sexual abuse and exploitation of children, our spokesperson has also issued a statement earlier on April 21 that we have actually been receiving several cases, and which we have referred to the Interagency Committee on Anti-Child Pornography. We are very much concerned that that there are various groups are also monitoring a number of online sexual exploitation cases, and there has been a widening of there has been economic worsening economic situation. They have pushed their parents to peddle their children to this kind of activity. So especially given the suspension of the classes, children also have extended screen time so that they have more time in front of their phones or their PC. So that the commission actually received the reports and again reiterating that this has been an alarming prevalence and that we as a gender ombuds we call on out any form of violence against women and children and that that the said violation be properly monitored and responded to by the government agencies. Also, we have been monitoring issues and concerns of vulnerable children to include those who have been subjected to abusive treatment for violating curfew and quarantine rules, and those in detention and prison facilities, as well as those children in the street situations. So the Commission on Human Rights have been receiving several reports of children being subjected to abusive treatment for violating curfew and quarantine rules. In fact, as of the moment, we have 10 cases which we have already referred to our regional offices and to the DALG for verification and investigation. The reports we have received include children being arrested, confined in dog cages, locked in coffin, paraded in the streets, and forced to sit for hours under the heat of the sun. These incidences shows disregard by the law enforcement on the protocol on handling children at risk as provided under the Juvenile Justice and Welfare Act. We have also provided the DILG, and we have already posted this in our Facebook account, a titleized version of the protocol because we see the need to disseminate the protocols to the local government units, especially the barangay enforcers, knowing that they have been cases which have been continuously reported in our office. We are actually received a reply from the DLG that they will be issuing an advisory to inform the local chief executives about this protocol. And we've also issued a statement on the children in street situations earlier this year, noting that there is a need to provide temporary shelter for children who are living in the streets and those who are in the street situation. Under the issuance of the UN Committee on the Rights of the Child, the general comment, we have endorsed the application of child rights approach to the government so that they be able to address the needs of these children without necessarily enforcing them to accept placements that are beyond their will. As to the children in conflict with the law, we have already coordinated with the BJMP and the Bureau of Correction to share various points that were raised in a technical note on children deprived of their liberty issued by the UNICEF and the Alliance on Child Protection. Among the recommendations that we have provided, we have forwarded to the Bucor and BJMP, is to provide the children deprived of their liberty with prompt access to specialized legal and appropriate assistance, to provide the children in detention facilities with the same level of health care and services available to children in the communities, and provide them with access and continuous contact with their loved one, either through correspondence or online communication. Also, we note that in RA 10821, there is also the need for us to promote and to come up with programs that will promote and uphold children's rights. On the part of the CHR, since the start of the lockdown, we have been actively involved in providing trainings and learning sessions through the use of online platforms, as well as in the development of child-friendly advocacy materials on children's rights. However, given the present scenario and the lack of resources, it has been a challenge for us to reach out to children and consult them on their needs and priorities. However, with the recent announcement from the Malacanang on the lifting of the ECQ in most part of the country, we should be able to reinforce our monitoring activities on the ground and gather information on the present situation of the children through our 16 regional offices. In the meantime, we have continuously been promoting several helplines to report cases of child abuse. We have also come up with a Tanggol Karapatan online e-lawyering where human rights victims can report cases of human rights violation and ask questions about human rights concerns. Lastly, and this is innovative and an innovation from the Gender Equality and Women's Human Rights Center, we have developed a response to GBV, to gender-based violence during the ECQ. So we have, through the help of UNFPA, we have developed a portal that aims to facilitate response, referral, and documentation of cases of gender-based violence during this time. So the reporting is not limited to those victims of survivors, but can be used by anyone as well, including the victims and their families. These cases are being responded to and documented by the Commission. This should help women and girls break the silence and make GBV visible during this time of crisis. So there. That's the end of my presentation. Hello? Hello, ma'am.
Sorry, na-unmute ko pala.
Yes,
Sorry. Attorney, have steps been taken to coordinate more closely with the police regarding offenses against children's protection?
Ma'am, as of the moment, we are trying to use our presence in several interagency committee to inform the various government agency of these concerns. But through letter advisory, we have also forwarded these concerns through different, such as the ALG, ma'am, and the Bucor and BJMP. However, with the police, we have yet to issue a advisory to them, but we have already also informed them of these cases, ma'am.
Pero have there been actual apprehensions of perpetrators ba?
Ma'am, as to these cases, ma'am, I have no idea. But on the part of CHR, investigations are already ongoing and are being handled by our CHR regional offices.
Okay, thank you very much. Any of our members would like to ask questions to CHR? And then let's proceed, no, because we're also pressed for time. So the next is Child Rights Network. May we ask Ma'am Camille Claire Madis? From Child Rights Network. Do we have a representative, please? ComSec. ComSec. ComSec ko.
Chair, good afternoon. This is Camille Harris from Plan International Philippines.
Yes, from
sorry.
Plan International.
Okay, from Plan International Philippines. Please proceed, Camille.
Okay, Chair. I will just share a portion of my screen. Can you see it? Hello, Chair. Is the presentation visible?
Yes, Camille. Thank you. Please proceed.
Thank you. Good afternoon, Pair of Children, for reviewing the implementation of RA 10821. We hope po that this assessment will enable stakeholders, especially government actors, to refine and quickly adjust their plans to better uphold, protect, and fulfill the rights of children as we respond to recent disasters and continue this battle with COVID-19. Nearly 5 years since its enactment, RA 10821 remains to be fully implemented. From our recent humanitarian response experience, we know po that LGUs are aware of the law but have difficulty in implementation. On the one hand, there are also responders who are hearing about the provisions of the law for the first time. Comprehensive Emergency Programs for Children, or CEPCs, whenever they are available, are not mainstreamed and institutionalized in LGU plans. This hinders successful implementation and leads to low prioritization and lack of resource allocation. There are also cases po where emergency responders like community and barangay leaders, community members, school personnel, and other rescuers receive the necessary child protection trainings after the disaster occurred. And due to lack of human resources, LGUs are only able to hold limited number of psychosocial interventions during an emergency. Sa ilan nga pong mga pagkakataon ay isang beses lamang. At sa isang rapid needs assessment na aming isinagawa, we have noted that most of the affected families erected tents and makeshift shelters using old tarpaulins within the vicinity of their damaged houses. So bakit po ito concern? Kasi even if there are child-friendly spaces established in evacuation centers, not all children are aware of these, nor can they access these spaces because many families prefer to stay in makeshift tents outside their homes. And we also know from the ground and news reports that schools are still being used as evacuation centers for prolonged periods of time. Minsan nga, kadalasan nga, more than 6 months pa. And as we also know, in emergency settings, LGUs struggle with too much workload and many still rely heavily on CSOs for child protection. The law mandates that CEPCs shall immediately be implemented after the declaration of a state of calamity or occurrence of any other emergency situation. However, doing so would be challenging if CEPCs are not localized and mainstreamed in the first place. LGUs are aware of the law, but are in need of planning and implementation support. As such, Plan International Philippines calls for the full implementation of RA 10821. But should the committee and Congress push through with amending the law, we would like to propose the following amendments to address implementation gaps and further enhance this essential piece of legislation. So first, strengthen the role of DILG to monitor and assist LGUs in adopting and implementing the law. So to this end po, we recommend to support and capacitate LGUs by holding orientations and planning sessions on RA 10821. Support the localization and integration of CEPCs in LGU plans and budgets, katulad na ng LDRRMPs, LCAPs, LDRRMFs, and BCPC plans. At saka na rin ang immediate activation ng child protection working groups to ensure implementation and resource allocation. Strengthen the monitoring and evaluation framework for the law and the monitoring plan for CEPC. Train all service providers and emergency responders on child protection, gender-based violence, and gender equality before disasters occur. Include the localized and integrated CEPC in the list of indicators ng ating Seal of Local Governance and indicators for child-friendly cities and municipalities. And let us ensure po that child protection responses are mapped and linked to existing and available child protection services so that referral mechanisms to other agencies and providers are established and that displaced people, including children, receive information on available services and their right to access them. And our second recommendation would be to include CEPC programs aimed at increasing the capacity of families to support children during emergencies. So to this end po, we recommend to support and strengthen the protective capacities of families and take measures to keep families together, which includes support for positive parenting programs or referral to specialized family services. prevent and address the root causes of child protection issues in humanitarian contexts. This includes increasing access to education. Kasama na rin po dito yung mga bata na walang access sa internet at gadgets, so they couldn't really join the virtual classes. And we need to expand opportunities for families to generate income and support community dialogue and engagement towards conflict resolution. Third, ensure the strong integration of gender in disaster management and emergency response. We at Plan International recognize that risks for children in humanitarian settings vary depending on age and gender. In emergencies, child protection responses often overlook adolescent girls, yet they face specific risks due to both their gender and age. So to this end, we recommend to strengthen the voice, leadership, and meaningful participation of girls and young women in emergencies. Ensure that child protection and gender-based violence interventions are gender, age, and disability sensitive, and that protection support services are strengthened during regular programming and continue to be available to children, families and caregivers, girls and young women, and communities during emergencies. We also need to conduct rapid gender analysis and ensure that needs assessments are gender and age sensitive, and employ participatory methodologies in order to capture protection concerns for girls and boys of different ages and allow responses to be tailored to their specific needs. We also need to improve the generation and use of evidence, as well as data disaggregated by sex, age, and intersecting identities to better understand and respond to child protection risks during emergencies. Prioritize, fund, and recognize as life-saving the sexual and reproductive health and rights of girls and women, along with essential health services for young children's survival and healthy growth. And of course, ensure that budget is allocated from the Annual General Appropriations Act to support full implementation of the law. And should the proposed amendment push through, we need to make sure that children and young people, especially, as well as LGUs and other main implementors, are engaged and consulted extensively to ensure that best practices, challenges, and gaps in implementation are captured and addressed. So that covers po our inputs to RA 10821. But I would also like to share that we are conducting a perception survey for girls and young women aged 13 to 24 years old. This is to determine their conditions, feelings, and situation amid the COVID-19 pandemic. And as of yesterday po, we have received over 24,000 responses nationwide. Once the survey findings are available, we will furnish the committee with a copy. And you may be wondering why girls and young women. Our experience shows that they are particularly hard hit in health emergencies. Even before the pandemic, girls already face double discrimination simply because they are young and female. And COVID-19 heightens the threats to their education, health, safety, and economic empowerment. Sa mga bahay, they face greater responsibility to do household chores and care for family members. Many might never return to school because of domestic tasks and the shift towards income generation. Their health and lives are also at greater risk due to reduced access to health services. We also know that quarantine measures increase tensions at home, economic and emotional stress on families, and limited access to protection services put them at greater risk of exploitation and abuse. And they are also more likely to take on high-risk work due to loss of jobs and source of income. And we also know from our experience in Ebola that these factors that I've mentioned, along with child early and forced marriage, all contributed to the rise in teenage pregnancy rates and the number of maternal and child deaths. Therefore, we call on our lawmakers and heads of agencies to put girls at the heart of COVID-19 response, because only by prioritizing their protection and needs can we ensure a safer Philippines. Thank you.
Hello? Hello? Comsec?
Yes, ma'am. Yes, ma'am.
It's, because I think I got cut off, no? But is Ma'am Camille already finished with his,
Yes,
with
ma'am.
her?
She is, ma'am. We're on to Dr. Anna Ong from the Ong Lim from the Philippine Pediatric Society. She's next. If we have no questions from our honorable members, that is, ma'am.
Yes, let's proceed if we don't have any questions. Please, we'd like to welcome Dr. Annalisa Ong of Pediatric Infectious Disease Society of the Philippines. If you can please proceed.
Dr. Ong.
Before, Comsec, before we proceed, can we just ask Plan International maybe to submit proposed or suggested amendments in writing so that the committee can study it?
Yes, ma'am. We are already in receipt of their PowerPoint presentation, which already includes their proposals for the substitute bill. We will incorporate them, ma'am, when we draft the proposed amendments.
Thank you. Thank you. Then can we ask, is Dr. Annalisa Ong?
I think her microphone is muted, ma'am. However, I cannot unmute her. I was probably taken out as a co-host.
I see.
I
Then
request our host po to unmute the microphone of Dr. Anna Ong Lim.
Can we ask Sir Romel if you can unmute Dr. Anna Ong Lim's microphone, please?
I'm muted na po.
Oh, it's back to mute. Ayan. There, let's unmute.
Wait lang, ma'am. It's medyo may problema sa internet connection po. Intermittent.
Kasi sabi ng ANES, they'll allow na the patient can stay back. Yeah. Pero where are your back nurses? I don't know.
There.
Comsec?
Ma'am, Dr. Anna Lim Anna Ong Lim, she's already unmuted.
Remember the mom, I would not agree that I will be the one to watch. I mean, there should be, I will demand that somebody.
Ma'am?
Yes?
Is Dr. Anna Ong Lim? Are you here with us? Ma'am? Maybe we should proceed, ma'am, with Save the Children.
Yes. Can we just ask Save the Children first, and then we can go back to Dr.
Anna Ong Lim. For Save the Children, ma'am, we have Attorney Emma Salmani, who will present for their organization.
Can we just ask Sir Romel if you can unmute yung mga hindi yung nag-report, please? If you can unmute them
Unmuted,
first.
ma'am. Unmuted na po.
Save the Children, E. Salmani, please unmute there. Thank you.
Can you please proceed? Si Ma'am Attorney Emma Salmani, please. Can you please proceed? Thank you.
Yes, good afternoon, Madam Chair and the members of the committee. I will proceed with the presentation of Save the Children. I am just sharing my screen. Can you see my screen already?
Hindi pa, ma'am.
Hello?
Hindi pa.
Ayan po.
Ayan.
Okay.
There.
Ang laman po ng presentation namin will respond to the 3 questions in the invitation. Number 1, the situation of children during the COVID-19 pandemic. Number 2, what the organization Save the Children have done to address the children's issues and our recommendations on RA 10821. So immediately after the declaration of the ECQ, we made preparations to conduct online consultations on children, and we were successful to do online consultations with children in Pasay City, in Cavite. We had a face-to-face consultation with children in Malabon, and we conducted an online survey on COVID and child protection with 587 respondents. The results of the consultations are, we lumped it into worries, fears, and impact, and then new roles and responsibilities, and then what are the recommendations. So the worries and fears and impacts of children, they are not prepared. They are worried because a lot of people are not complying with ECQ guidelines. They are worried about the rising number of COVID-19 affected people. They fear of being infected personally and for their family members. They are worried about the loss of job of their parents and where to get food for the family. For children with disabilities, they are worried about how to get medicines and treatment. They are sad because the moving up ceremonies were postponed. They cannot meet up with friends, ask about the risk. They are worried about the risk that frontliners are facing. They are worried about people dying from COVID. For children in Bahayang Pag-asa, they are sad because visitations were canceled, and they are worried about the condition of their families. For the new roles and responsibilities and activities that they are missing, they are doing a lot of household chores. They are working on school lessons sent to them by teachers. However, those without internet access cannot comply. They update themselves on current events through Facebook and news program. They practice good hygiene to stay healthy. They read stories through Wattpad, learn dance steps through TikTok. They miss staying outside, hanging out with friends, attending religious ceremonies, going to the market, and they cannot go to internet shops because of the ECQ to submit their schoolwork. On their knowledge of the government and its responses, they know that barangay officials distributed relief goods consisting of 1 kilo of rice, 2 cans of sardines, 2 packs of noodles, consistent public announcements at night urging people to go home and stay at home because of the curfew are made. Some of the relief provided were not inadequate and will not last for long. They do not know when the next assistance will come, and some do not know if they will still receive assistance from government. The government is trying to find a cure or solution for COVID-19, and the government is sharing information about COVID-19. Experiences of boys and girls. Girls are expected to do more housework than boys. But girls are not worried about how they look because they cannot get out anyway. They spend time chatting with friends on Facebook. Boys, on the other hand, are more relaxed and not helping much in household chores. They spend their time playing games in their cell phones. But both boys and girls think that they are not affected by the lockdown because they cannot go out anyway. These are the recommendations. Enough provision for relief goods should be provided. If possible, distribution should be made every 3 days. For children with disability, cash assistance for at least 1 month to cover the cost of medicines. They call on people to vote wisely so that they can select their leaders. Face masks and alcohol should be distributed. Immediate assistance should be provided to relocatees. Ensure access to health services, especially for children with disabilities. Information materials about COVID-19 should be child-friendly. Information about the social amelioration program and beneficiaries should be provided. encourage beneficiaries of the SAP to ask the LGUs what they are entitled to receive, and give social messages on how to protect children from online abuses, include information on how to report, where to report, and updated hotline numbers. So the next will be what the Save the Children has done during the COVID pandemic. Distribution of gender-sensitive hygiene essentials, COVID-19 risk mitigation and containment materials for families. These are printed materials for families in Malabon, Taguig, Tanay, Pasay, and Naik. These are also the sites where we distributed hygiene essentials. We provided an MHPSS resource person for the DepEd MHPSS webinar upon request of DepEd Caloocan. We also produced child-sensitive IEC materials on COVID-19 prevention and containment, and some of them are translated in the local dialect. We shared activities for learning continuity online, tips on how to prevent online sexual abuse, also parenting tips on how to manage stress. We raised issues affecting children as a result of the ECQ2 media releases and interviews, and produce radio plugs on COVID-19. These are just samples of the communication products that we have produced for COVID-19. These are some of our social media content. This one is the stay at home and make origami is an activity that the children can do at home. This is a learning activity. The how are you is how we want to know the condition of the children, how are they faring in the face of pandemic. This one is an information on how each and every one can help prevent the spread of pandemic. We also helped create a Facebook group where child-friendly information about COVID-19 can be accessed. This is so far the reach of our communication materials as of April 28. We reached 3,353,841 people. Our total media engagements total to 105. 10 press releases distributed, 94 articles published, and there were 11 media interviews. Following is our recommendation on the enhancement of RA 10821 and the Comprehensive Emergency Program for Children. RA 10821 mandates the formulation of a comprehensive emergency program for children and the localization of the CEPC at the local level. However, not all LGUs have localized the CEPC. So there is also an issue of providing budget to implement the CEPC that are localized at the LGU levels. So I will present our recommendation based on the components of the CEPC. So component 1 is the use of schools as evacuation centers. Schools can be used as evacuation center only as a last resort and for a maximum of 15 days. This is under Section 4 of RA 10821 and Rule 5 of the IRR. Our recommendation is to revisit the guidelines on the use of schools as evacuation centers, since schools are now being used as quarantine facilities. We would like to include the use of schools as quarantine facilities and include additional guidelines on how to sanitize the schools so that children will be safe when they return to schools and use the classes. The second component of the CEPC is the establishment of transitional shelters for orphan, separated, and accompanied children. Our recommendation here is to review existing guidelines to cover orphan and separated children as a result of COVID-19 and to establish child-friendly quarantine facilities for the children affected by COVID-19. When the discussion was made for this law and for the IRR, the context was children affected by disasters, physical disasters, not disasters resulting from health hazards and emergencies. So there may be a need to revisit the guidelines so that hazards resulting from health emergencies can be included. Okay, I have already. The third component is assurance for delivery of basic needs and services. This is under Section 4, RA 10821 and Rule 7 of the IRR. We will recommend to revisit the contents of the relief packs to ensure that health and nutrition needs of children up to age 5, pregnant and lactating women, and the relief pack should be sensitive to the needs of indigenous people and those belonging to religious minorities. We also urge that data collection should be undertaken during contact tracing activities of the affected populations, and the data should be disaggregated by age, sex, and disability. We also recommend to revisit the existing modes of delivering counseling support for infant and young child feeding for mothers other than the face-to-face mode, considering the lockdown and the quarantine being imposed at the moment, to ensure the delivery of health, medical, nutrition, adolescent, sexual, reproductive health, and motherhood services and commodities to infants, children up to age 5, adolescents, and pregnant and lactating women during the pandemic, and also explore other modes of delivery of these services other than face-to-face, and to revisit the content of the relief packs so that they are more gender sensitive and can address the nutritional needs of children and pregnant and lactating women. On the stronger measures to ensure safety and security of children, we recommend to orient barangay officials and others involved in the implementation of quarantine guidelines on children's rights, on children's rights and other relevant laws and policies to prevent abuses and violence committed against children. When the quarantine has started, there have been a lot of violations on children that were reported. We would also recommend to revisit the reporting mechanisms under the CEPC and adapt to the current health emergency and allocate sufficient resources to ensure its functionality. Because of the quarantine, children cannot report to their teachers because schools are suspended. They cannot go out of their houses to report because of the quarantine. And there has been a lot of incidents of domestic violence. We would also advocate for the enactment of a child protection policy in all LGUs. The child protection policy must include a provision on non-discrimination and non-stigmatization of children and their families who are affected by COVID-19. This discrimination and stigmatization of children and their families of frontliners are prevalent. We would also recommend to revisit the current modes of delivering counseling support. We would also recommend to ensure continuous access of infants, children up to age 5, children with disabilities, adolescents, pregnant and lactating women to health, medical, nutritional services during the pandemic in a safe and sanitized facility. On the plan of action for resumption of educational services for children, this is Section 4F, RA 10821 and Rule 10 IRR. We recommend to only use schools as evacuation centers or quarantine facilities as the last resort, and revisit existing guidelines to include sanitation of the school premises used as quarantine facilities to ensure the safety of children when they resume classes. On the establishment of child-friendly spaces in evacuation centers and transitional sites, we recommend that quarantine and treatment facilities catering to children affected by COVID-19 must be child-friendly. The frontliners must be oriented on children's rights, and provisions for continuing learning activities and communication between the children and their families are in place during the confinement. On the promotion of children's rights, we recommend to continue consulting with children to find out what they need, what their fears are, what their anxieties are, and consider these concerns in planning interventions for their benefit. We also recommend to orient medical frontliners and other officials involved in the implementation of the ECQ guidelines and the Bayanihan to Heal as One Act on children's rights. We also recommend to ensure that IEC materials on COVID-19 are age appropriate and child sensitive, to consult with children in conflict with the law and children at risks to find out what their specific needs are during the pandemic and consider them in providing interventions. And we would also recommend to ensure that communications facilities for CICLs and CARs with their parents and families are in place. That is all for Save the Children. Thank you very much. Hello.
Ma'am Yeda is muted po. Si Ma'am Yeda is muted. There.
Okay.
Thank you. Ma'am
Ay,
Yeda
wait.
po is, ayan. Thank you.
Ayan. Hello?
Yes, ma'am, we
Hello,
can
can
hear
you-
you now. We can hear you now, ma'am.
Thank you very much to to Attorney Emma Salmani of Save the Children. Thank you very much for that comprehensive recommendations. I hope we can also highlight the best practices on which we can benchmark our future practices. Alam niyo naman, there is a huge disparity between policy and actual application of the law. So I hope with your recommendations, we will be able to make the proper amendments to our to that law. No, but anyway, our next presenter is from UNICEF, or is Child Rights Network ready na, Comsec? Comsec? Hello? Comsec? May we ask Attorney Anjanette Sagisag of UNICEF for her presentation, please?
Okay, good afternoon, everyone. Good afternoon, Madam Chair. Can you see my screen now?
Yes, Attorney.
Okay, so let me proceed. What I've also prepared is similar to the outline that Save the Children has followed. But I guess what we want to do now is zoom out. We're all using Zoom, but we want to zoom out and maybe look at how the world is faring right now and what is really happening. What is really the impact of COVID-19 on children? And I want people to start thinking about resilience. It's no longer about just immediate response and early recovery, but it's really about how should children be viewed in the new normal and how should this resilient framework look like in the context of the Philippines. The United Nations issued a very recent policy brief, and this is just to emphasize that this is not just from the UN, but the entire UN family about the impact of COVID-19 on children. And it starts with a statement that the COVID-19 pandemic presents the greatest test the world has faced since the Second World War and the formation of the United Nations. We see that COVID-19 has several transmission pathways. And I think a lot of our speakers have already alluded to this and recognized this. But I want to emphasize that there are three perhaps pathways where how children can be impacted by the virus. One is that there is a infection itself of the COVID-19 virus, and in this case, children can suffer from both social and economic impact of the disease. The second pathway is where children are affected by the socio-economic impact of the containment measures. And I think this is what the difference between the two has also been emphasized by a lot of the speakers. In the first pathway, we know that children are the minority in terms of those affected by the virus directly, but in terms of socioeconomic impact, it affects all children in all communities, coming from the urban, coming from the rural population, coming from the rich, from the poor. All children are actually affected by the containment measures. And when I speak about containment, it's about the quarantine measures, the limitation in travel, restrictions in mobility, the measures that government has now adopted in order to control the spread of the virus. And those are the containment measures. The third, and perhaps not given as much attention right now because it looks at long-term impacts, is actually the virus will potentially have an effect on delaying the achievement of the Sustainable Development Goals. I'd like to remind everyone that the world has actually committed to Agenda 2030, and we have 10 years to achieve that. And according to monitoring of this, again, achievement of the SDGs, we are seeing that there are substantial delays already in achieving these goals. There are multiple effects on children globally, and what we are seeing right now is that there is more children falling into poverty. An estimated 42 to 66 million children all over the world can fall into extreme poverty, adding to the already estimated 386 million children living in extreme poverty in 2019. We also see an exacerbation or exacerbating the learning crisis. Based on global monitoring of UNICEF, 188 countries have imposed countrywide closures of schools, and this is already affecting more than 1.5 billion children and youth. The COVID-19 pandemic is also a threat to child survival and health. Malnutrition is expected to rise to 368.5 million children across 143 families. And we all know that the Philippines already has very severe malnutrition rates. We also see that the infant and child deaths can also increase because of disruptions in the delivery of essential health services. COVID-19 is also a risk for child safety. 60% of children worldwide live in countries where a full or partial lockdown is in place, and we are seeing increasing cases of domestic violence in the home. Given all of this global situation, at the global level, UNICEF is also advocating for 6 actions for children. I think a lot of our resource persons have already spoken about this. And maybe what has not been emphasized as much is number 2 and number 6. Number 1, of course, we've already talked about the importance of keeping children healthy, ensuring that essential health services continue to be delivered, malnutrition is addressed. Second, the vulnerability of children is actually heightened by the problems that we have on water, sanitation, and hygiene. We all know that hand washing and proper coughing etiquette actually helps to contain or prevent infection. And yet a lot of this is also dependent on water, access to clean and safe water, sanitation facilities, and proper hygiene practices. And this is something that we need to emphasize even in the children in emergency legislation. We need to keep children learning. Number 4, we need governments to support families to cover their needs and care for their children. Family support, we often talk about children, and the best way to really support children is to make sure that the families are able to provide for the basic needs. And this can come in both in financial assistance, in providing food packs, but it's also about creating an enabling environment where the families can take proactive steps to protect and meet the needs of their children. The fifth is also to protect children from violence, exploitation, and abuse. And number six is really to adopt special measures for children who are already being left behind. So in the context of countries that have refugees, migrant populations, internally displaced children, and children in armed conflict, special measures need to be adopted for these children. Now, in the Philippines, we already know that the pre-COVID-19 situation for children was already problematic. We know that 3 out of 10 Filipino children live below the poverty line. This is even worse in the Bangsamoro administrative region, where we see 6 out of 10 children living below poverty. We know that 1 out of 3 under 5 children under 5 suffer from malnutrition. There's already dropping immunization rates even before COVID-19, and we also saw the resurgence of polio, which the Philippines had originally eradicated already. We know that there's already 2.85 million out-of-school children, and we also know that 2 out of 3 children are victims of physical violence, and sadly in the home. We've seen that the COVID-19 pandemic is going to make this situation even worse for children. So we have to reimagine what resilience really looks like, and we really need to reimagine how we can do our work better for children. From UNICEF, the UNICEF Philippine response to COVID-19 is a broad range of interventions. We are currently working with the Department of Health, WHO, UNFPA, World Bank, and USAID to strengthen the public health response. UNICEF also has a response plan that incorporates risk communication and community engagement, support to infection prevention and control measures, case management, and procurement of supply and logistics supports. UNICEF is also looking into social science research on the social and economic impact of COVID-19 on children, and this is in partnership with the UNDP, and this is intended to complement the work of the World Bank. We are also currently working with the Bangsamoro Bangsamoro Autonomous Region of Muslim Mindanao to provide emergency cash transfers to poor households with children 0 to 2 who are also excluded from the SAP as a means of pilot testing and modeling interventions of emergency cash transfers in the context of COVID. So in terms of recommendations on the legislation, before going to the specific recommendations, we also want to put forth to the committee some general observations and recommendations. One would be to fast-track efforts to update the poverty registry or listahanan, develop the risk and vulnerability registry, and we understand that NEDA has identified this as a priority as well, and the Philippine National ID System. We see that this lack of this registry also contributed to the delay in the relief operations. We're hearing a lot of stories from local government units where they're struggling to identify who needs the assistance. Having a poverty registry in place or a vulnerability registry and linking it to the Philippine National ID System can actually fast-track relief operations. We also hope that the committee will consider providing poor and vulnerable households with a minimum basic income or expanding social protection coverage. We know that the 4Ps has recently been enacted into law, but there is a cap of 4.4 million families currently being covered under the 4Ps. And we also know that COVID-19 is going to exacerbate poverty. Can there be an effort to increase the number of families who will then be covered by the 4Ps? We also think that and last among the general measures but certainly not the least, we see that there will be serious economic impacts to the Philippines and to the world, and we are seeing that a lot of countries and even in the Philippines this is going to impact on the economic development of the country. We are also aware that economic stimulus package and austerity measures need to be in place, but we also are advocating that these austerity measures do not cut for social spending for children. We are hoping that the government will seriously consider not cutting the budgets for education, not cutting the budgets for health, not cutting the budgets for social welfare, because these are basic social sector spending items that can have a serious effect on the health and well-being of children. For the specific proposed amendments to RA 10821, for Section 4, we recommend to include health pandemics as one of the hazards. We also recommend that the committee considers the situation of children who cannot be evacuated into evacuation centers and need to stay in their homes, and there's a need to establish minimum safeguards. The third on Section 4 is to consider cash transfers and access to other social protection services as a means of providing for the basic needs of children. We've seen, based on our experience, that it's as long as the markets are functioning, as long as the supply of goods and commodities are there, and you provide access to these markets, what hinders families from actually providing for meeting their basic needs is actually the cash. So we think that cash transfers and access to other social protection services will be a minimum package when we start emergency response. And this should definitely benefit children. We also know that evacuation centers are currently being used as quarantine facilities. Local government units are coordinating with the EPED, seeking permission. But we hope that Section 8 will also emphasize that if the schools are identified as quarantine facilities, this should have minimum disruption on the learning of children. We also think that for Section 6, the law should enable the establishment of temporary care and supervision measures for children who may need to be temporarily separated from their parents and caregivers. We see that the provision seems to look at permanent measures, permanent situations of being an orphan or an accompanied or separated. But what we know from the pandemic is that there are instances where children need to be separated from their family, from their caregivers, because their caregivers or their parents are the ones infected by the virus. And we need more protective measures to ensure that this temporary separation is actually figured into the legislation. We also think that Section 7 on the system of restoring civil registry, that this should be clearly linked to the Philippine National ID system. So if records are actually destroyed and there needs to be a reconstructions of civil registration with the current efforts of the Philippine National ID system, we think that it's smarter to ensure that the reconstruction of these civil records also comes hand in hand with the Philippine National ID system and issuing children their IDs. We also think that the training of emergency responders should also, because there's a list of emergency responders that need to be trained by NDRRMC, but it does not include frontline health workers. And we all know that based on the COVID pandemic, frontline health workers are actually come into contact with children very often. So we hope that they can also be included in the trainings for emergency responders. On the data gathering, and I think this is one of the core, and we've already emphasized this in the need for a registry. Local governments are actually required to have a barangay registry, but in the data collection, in the data gathering, we encourage that the LGU should update their barangay registry, especially the family profiles, to facilitate relief measures and early recovery interventions. Let me close by just a reminder that the Philippines is not alone in going through this pandemic. Now is the time to step up international solidarity for children and humanity, and to lay the foundation for a deeper transformation of the way we nurture and invest in our world's youngest generation. Maraming salamat po.
Thank you, Attorney Sagisag. Thank you, Attorney Anjanette Sagisag. I hope UNICEF can work more closely on improving our
Yes, ma'am.
community strategies for children, for them to understand and appreciate the crisis. I think our next presenter is Miss Jennifer Cueva of the Center for the Prevention and Treatment of Child Sexual Abuse. Is Miss Jennifer Cueva, Comsec?
Yes, ma'am. She's here, ma'am. I will just try to unmute her. The Center for there. She's unmuted. Jennifer? Jennifer, are you there?
Hello?
Ma'am?
Yeah, we can hear you, Jen. Yeah, we can hear you. Jen, it's your turn.
Can I see the PowerPoint? Is it there?
Comsec, can you kindly facilitate yung PowerPoint lang?
Okay. I will send it po to, I'm sorry. I thought it was going to be them again. Yes, ma'am. It is ready. But in the meron po? Do you? I have it, ma'am. Wait, I will just open it for everyone.
This is a quick presentation.
See? Yes, ma'am. Yeah. Oh. I'm sorry, I'm using my cell phone, so I will just send it po ulit to Pastor Romel. May I send it to you, Sir Romel? Is it okay po? Anyway, ma'am.
Yes. Can you send it through the Viber group, so I just have a copy of the presentation?
Yes, ma'am. We will send it. We have it, ma'am, but unfortunately I cannot open it right now. I'm sending it now po to our co-host, Pastor Romel, if he can probably play it on his. You can feed it to us.
I'll just ask our participants to be patient, no, because it is our first time to have
Yes,
this
ma'am.
Zoom. And I hope
We
you understand
also
the difficulties we are encountering.
Yes, ma'am. We are also apologizing because Pastor Romel asked me told me earlier today that his signal is actually intermittent. That's why the chairperson was cut off earlier. And I was also cut off several times. It's probably my own signal that was. I will. Sir Romel, do you already have it? I'll forward it to you also, Sir Jude. And it's there. And
For sure, I'm very relieved.
So can I start?
There, thank you. That is the one, ma'am.
Okay. So good afternoon. So I'm from Center for the Prevention and Treatment of Child Sexual Abuse. Is an NGO in Quezon City, and we are based on our name. We are catering for the prevention and treatment of child sexual abuse. So just a quick report of what we have done, and also what we have received regarding the welfare of children in terms of child sexual abuse. So, can we proceed?
Please proceed.
Please click. Okay. Sige, click next slide po. Okay. So, yan. Sige po, click. So, we are focused on working with children to have a safer world for children. Sige po, click lang po. Next. Next. Where's the PowerPoint? Yan.
Well,
Hello.
that is your Viber communication with our ComSec, Romel. ComSec?
Okay, so can I go? There's no PowerPoint. So yeah, the issues of CPTCSA that we have received from, because we're conducting also online counseling sessions with the clients, and also we have received some reports through our Facebook, Messenger, and email regarding the situation of some children during the lockdown or this ECQ. So one of the issues that I identified was the sexualized behavior of children in institutional care, wherein there are some centers who are catering with children that manifest or shown sexual behavior. So there were incidents wherein the children touches each other, something like that, and there were shown some yun nga, parang, yun nga, they start touching each other, they started to victimize one another while they were in the center. So we have also received that reports, something like that, and the center didn't know how to respond to that situations. So we also have received cases of incest wherein children are parang trapped with their offenders while they were in the house. And also there are other reports wherein children were also fear when the ECQ was lifted because they might be reunited again with the offenders, something like that. So these are some of the reports that we have received. Also, some online sexual exploitations. There are asking through our Facebook about what they do about the online sexual exploitation because some children right now are focused on the internet, and also the parents didn't know what to do, and also anxieties of children during COVID-19 because some of the children shown that they're so anxious, they didn't know what to do, they didn't know, the parents didn't know how to respond to the anxieties of the children. So next slide, the last slide, the plans and recommendations. So CPTCSA, we are now what do you call this? Revamping our plans for this year. We have in terms of COVID-19. So one of our plans is to conduct training on personal safety lessons in institutional care. This is to address the sexualized behavior of children in the centers. We plan to train the house parents, the social workers, on how to deal with the children who were manifested sexual behaviors while they're inside the center. We also plan to develop online counseling programs. We are in the process of creating protocols and also the systems for the online counseling program so that we can address the children even it's not face-to-face counseling session. So we'll conduct online counseling session, and also crisis care management for caregivers. This is one of our we will start this thing tomorrow. This is to have crisis intervention or crisis care not only to children but also to the caregivers and frontliners, so that this is to address some of the anxieties of the children regarding this COVID. Then crisis care response also for the children. This is different for the counseling session in terms of sexual abuse, but this one is related to COVID for children. So aside from that, networking for partners for immediate concerns, the barangay, the psychiatrist, if the children need psychiatrist, something like that. Also, we also develop weekly activities for children. So this is to ease the boredom, to address the boredom of children while at home. So it's uploaded in our website, and also in partnership with some of our barangays, we also disseminate some information for the parents and children regarding the COVID. And at the same time, there's also points or inputs regarding the protection and safety of children against child sexual abuse. And also, we plan to develop games, books for children during this ECQ. Okay, so that's it. Thank you.
Thank you very much, Ms. Jennifer Cueva of the Center for the Prevention and Treatment of Child Sexual Abuse. Thank you very much. COMSEC. COMSEC, do we have any other presenters? Is Dr. Ong Lim still here? COMSEC.
COMSEC Jing.
COMSEC Jing. COMSEC Jing. COMSEC Jing. I just want to make sure, no? COMSEC, do we have any other presenters, please?
Okay na po lahat, ma'am. Wala na, ma'am.
Wala na. Okay. Thank you. Thank you very much. I'd like to thank everyone and, for your support and cooperation despite encountered some technical difficulties. But thank you for making this a very productive meeting. This is a very fruitful meeting. We shall collate all the concerns and suggestions raised this afternoon, including the proposed amendments to the existing legislation, which will be incorporated into a substitute measure to be authored by the members of the committee. We would also like to acknowledge our Zoom host, si Pastor Romel Pastor, as well as the ICTS staff of the House of Representatives. Likewise, we would also like to thank our resource persons for their time and expertise during this meeting. Finally, I would like to thank the honorable members of this committee for being with us today. There being no matter to be discussed, do we have a motion to adjourn? I hope we still have members. Ang ating mga members. COMSEC Jing.
Ma'am, I think they already left for the Congresswoman Abunda. They already have left for the session hall, ma'am. Maybe you can adjourn. Okay.
But this meeting is
Congresswoman Vergara's also in the session hall already.
Yes.
So, yes, ma'am.
Well, then there being no
yes, ma'am.
Discussed, then this meeting is adjourned. Thank you very much, everyone, and thank you for your patience and just being very supportive of this meeting. Thank you very much.
Thank you, Madam Chair. Bye po.
Thank you. We apologize for the technical difficulties. On my part, I'm sorry.
Congratulations, COMSEC Jing, despite all the
Ma'am, congratulations.
Very full meeting. Thank you very much.